Thanks for coming. It's a nice turnout this morning. We're a little bit behind schedule, but as vets, we're never on time, so that's expected. Last year we did a couple smaller seminars. This year we tried to do one more bigger, medium-sized. But I think we have a really nice lineup for you today of some good educational things, and we've got a ton of great door prizes that were donated. So we're going to be doing the draws for that right after lunch, so make sure you don't sneak out early. You need to stick around for the door prizes. There's a lot of good ones there. What we're going to do today is we're going to have a couple sessions, then we'll have a little break for coffee. We'll do 2 more sessions, and then we'll have lunch, and then 2 more sessions at the end. So we're going to get you out of here by 1:30. We're going to try to keep things on track, and hopefully you'll have a good day. I'm Chris Berezowski. I'm one of the vets, one of the owners at More Equine, and we're really happy that you're all here. And we're going to get things going so we don't go too far off schedule. But if you have any questions during the presentation, just kind of hold on to them, because at the end of the presentation we'll do a little question and answer period if you have any things you'd like to ask. So start us off, we have 2 of our intern veterinarians, and they are actually real veterinarians. They are doctors, but we call them interns. So what that means is they come and work with us for 1 year. It's a pretty intense year. So you'll see them around the clinic, you'll see them on farm calls. They do a lot of the hospital care. They really do everything. They're very hardworking group. We have 6 interns, and they rotate through various parts of the hospital. And to kick us off, we have Sarah and Shannon, and they're going to give us a nice update on vaccines, dewormers, dentals, all those kind of preventative type things that can, hopefully limit the the serious cases that can happen. All right, ladies, you ready?
Okay. Whoa. They told me to come close. This was too close. Okay. Hi, so I'm Sarah, and this is Shannon. And as Dr. Berezowski just said, we're going to talk to you about vaccines, dentals, and deworming. So to start off with vaccinations, so what do? They kind of prep the horse's immune system. Oh, I did too much. Oh my goodness. There we go. So vaccines prep the horse's immune system and kind of to prepare them for diseases that they might encounter, either in their environment or from other horses. And it's important to remember that not every horse will have the same immune reaction to a vaccine, so no vaccine is 100% effective, but it's all in preventative measures in trying to prep them for the diseases they might encounter, such as when you train before a barrel race or a roping event, you know what you're going to encounter in the field and in the arena, compared to if you've never seen it before. And so at our clinic, we have 2 main methods of vaccination, in the muscle and in the nose. Now, the muscle ones create a systemic or a full body response to the disease. Some of you may have encountered some vaccine reactions because we usually vaccinate in the neck or in the rump of the horse. And these reactions can look like a little bit of swelling or heat in the area, but they usually resolve in a couple days. Some horses don't respond well to vaccination, and so those horses will sometimes opt not to vaccinate, but it's catered to each horse's criteria, experience, and requirements for their perceived job. The other option is intranasal, and these ones tend to have a local reaction in the nose itself, in the mucosa, as well as full body, and they tend to react less, the horses. However, they are harder to administer, as some of you have experienced the strangles vaccines. By the 2nd or 3rd time we come around, they are over it. And so it kind of, again, it's catered to every horse in their unique situation about which vaccines we use and when. And in regards to that, that's why it's important to know what we're vaccinating against. So we kind of break it up into horse contagious diseases. And so the environmental ones, they can be infected, I want to say, between soil, like tetanus. A lot of people think of tetanus as something that you only get from a rusty nail. It's actually a bacteria that lives in the soil as well. So it's in the environment. And then the others are neurologic ones that are primarily transmitted through mosquitoes or insect vectors. So again, things in the environment that we can't control, that we just try to prep our horses for. And then the other ones are ones between horses. So influenza, rhino is herpes, and then strangles. These can all be transmitted horse to horse. So again, it depends on if your horse is traveling a lot or if you have neighbors nearby, they share a fence line, transmitting between horse and horse. And so in here, these ones are aerosolized. So that means they travel through the air and they can travel up to 2 miles between horses. So that's why it's important to just recognize that even if your horses are vaccinated for these, if your neighbor's horse isn't, that could lead to a disease, even if your horse is vaccinated. But that's the whole point of vaccination, is so that the disease is less severe if vaccination is on board, or help mitigate those signs. We also have a couple other ones too, rabies and Potomac horse fever. Rabies is present in Alberta, and it is included in the core vaccine for horses. However, we don't tend to vaccinate a lot for rabies in horses because we find horses react more to the vaccine that contains rabies, but it is always an option for full protection, whatnot. And if your horse has not reacted in the past, it is an option to tag on as well. Potomac horse fever is a GI disease caused by a bacterium that occurs primarily in the late summer, July, August. And again, we do have a vaccine for this because it kind of comes in peaks and waves over the years. In the past couple of years, we've seen it as early as May and as late as October, November. So it's very variable in when it comes around. And the vaccine for it does exist. It's not the most efficacious vaccine compared to the other ones we have. So again, it's more of, it's available if you want it, but it's not one that we typically go to straight away. In terms of what we go to, these are the products that we offer. So we have a wide variety of products available, and some of them require special ordering. Some of them shouldn't be used in mares that are in foal because they don't provide the best response towards that. But a big distinction that we do want to make that often people get confused about is the 4-way versus the mosquito shot. So the 4-way does not include West Nile. And so a lot of people call in because they think, oh, I want all the environmental ones, the tetanus, the West Nile, the Eastern and Western equine encephalitis. That's our what we call our mosquito shot. The 4-way does not include West Nile, it includes the influenza instead. And so that's just a distinction that we want you guys to know as clients, so that when you call to book your vaccines, we find a lot of people say, oh yes, I want the 4-way, and then the miscommunication is they think they got the West Nile when they didn't. And so that's just a distinction we wanted to make here. And so in terms of vaccine schedules, we recommend annual vaccines, primarily in the springtime, because most of the diseases we're concerned about are transmitted by mosquitoes. Mosquitoes come out in the summertime, so we want your horses to be prepped and ready to go prior to that. There are different schedules options. So for brood mares and stallions, we recommend generally a 3-way and a flu rhino prior to breeding season, just to limit disease. Mares in foal, we recommend vaccinating with rhino at 5, 7, and 9 months of pregnancy because rhino is caused by the herpes virus, and one of the ways herpes presents is in abortion storms. And so with the mares that are pregnant, that's the main factor we're trying to limit in that circumstance. Foals and weanlings, we usually recommend a 3-way and a flu rhino at around 6 months, and then another booster vaccine 4 weeks later, just because it's the first time they're being vaccinated, so an extra additional booster helps their immune system in that sense. And then yearlings, a 3-way and a flu rhino. Now with all these guys, West Nile is a good idea to tag on as well, because again, the 3-way does not include West Nile, neither does the 4-way. But West Nile is good to have just because even this year we have seen more West Nile cases than we have previously. It tends to peak and valley, and this year seemed to be a peak. And the clinical disease as it presents, it's mostly supportive care that we can provide, fluids and whatnot, but they do act neurologic. And so with all these, West Nile is a good idea to have as well. And so that's the vaccines, and now onto the dewormers. So the main point of dewormers is to decrease the parasite load in the horse. Horses are out on pasture, they're grazing. Having no parasites is very, very rare. So our intention is to reduce the load so that they don't cause clinical disease. And so just to go through the main ones that we're going against briefly, we have ascarids, which are roundworms that are predominantly in young horses. You might hear us talk to you about them a lot in your yearlings. And so those are ones we're kind of targeting with younger horses. Small strongyles, they insist in the intestine, and so they're a little bit harder to get. But the long strongyles are the ones that cause the most harmful horses because they can get into the blood veins, cause clots, go to tissue, and cause the tissue to die off and necrose. So those are ones we're targeting a lot with our dewormers. And then we also have the roundworms, which, the tapeworms, which can cause colic because they occur at the junction between the small and the large intestine. And if they build up, they can cause a blockage and cause colic. Pinworms are the ones that when your horse gets an itchy tail that you might come across, and they're just annoying to deal with. And then the bots, if any of you have ever had a gastroscope done on your horse and you see the little red bots in the stomach, they don't usually cause disease, but they can affect digestion if they're a lot in there. And so we're trying to curb those as well. And so then the products that we offer, they're different drugs for different purposes. And so ivermectin is one people use a lot. And it's a great drug. It gets most of the parasites on the first try, and we usually give this one in the spring, ivermectin product. Moxidectin, or your Quest Plus, is another great one. It's good for internal parasites. We have Strongid. It's effective against internal parasites as well, usually used in deworming foals. And we have fenbendazole or Panacure. Some of you may recognize it as like the Panacure pack that we do, which is like 5 days of Panacure. And that's used to control adult and immature roundworms, which make up the bulk of equine intestinal parasites that we're going against.
All right, thanks. Yeah. All right, so now we're moving on to talking about dentals, the key points. So in addition to vaccines and dewormers, routine dental exams are an important part of your horse's wellness plan. And so to start, I'd like to just highlight some of the unique properties in terms of equine dentition, what makes horses unique and why do they require at least annual dental examinations. So horses have something called hypsodont teeth, which mean that their teeth continuously erupt throughout their life, and this is different than humans, cats, and dogs. And their teeth are composed of a variety of different layers of different strengths, and this allows for the creation of an uneven surface, which is necessary for grinding their feed. So they have different sizes in terms of their upper and lower jaw. That mandible, the lower jaw, is narrower than the maxilla. And so they have this unique chewing action, which ultimately leads to the creation of sharp points on the edges of their teeth. And in this image, you can see that on the lower jaw, the sharp points have been created on the inside, and on the upper jaw, the sharp points have been created on the outside. So that is typically what we expect to see in your average horse. And then in the picture on the right, you can see this is a horse that has had those sharp points floated or reduced. And this overall increases the range of motion of their jaw while they're chewing. And so horses have deciduous baby teeth as well as permanent teeth, and they shed the baby teeth as caps. So you may have heard your veterinarian refer to caps before, and you may have wondered what they were. These caps usually don't cause a problem, but they can be retained. So in these images, you can see the difference between baby incisors, which are very short and round, and then adult incisors in the middle, which are much longer. And then the picture on the right is of a retained incisor cap. And so this would be an instance where veterinary attention is required to remove that so that it doesn't create further imbalance within your horse's mouth. The premolars also have caps. And you can see in this radiograph the short little teeth that will be eventually pushed up by the permanent teeth as they erupt. And so you may have found these caps before in your horse's stall and wondered what they were. This is completely normal for them to shed these caps on their own. Sometimes they don't shed appropriately, and so they once again can be retained. And so in the image on the bottom here, this is a retained cap. And if that cap is retained, then it can cause problems with the opposing tooth, not allowing it to grow in maybe as long. And so on your horse's regular dental exams, especially the young horses who have these caps, your vet can check for them. If they identify them, we have cap extractors that you just place on the tooth, rock side to side, and if they're already loose, they'll come free pretty easily. And so people always have questions about wolf teeth too. What are they? Does my horse have them? Do they need to be removed? So wolf teeth are technically the first premolar, and they're erupt in 20 to 50% of horses around 5 to 6 months of age. And so this is why at castration, we commonly check to see if wolf teeth are present and often remove them under anesthetic at this time. So they can interfere with the bit, so this is why in the past they were almost always removed. These days with modern dentistry, we've now changed our tune and we don't always remove them unless it's indicated. So in a young horse that you're putting into training that's going to have a bit in its mouth, it can be a good idea just to remove them as a preventative measure. But sometimes these wolf teeth are very small and very close to the second premolar, and they really don't cause a problem. Other times, if there's a big gap or they're very large, then they can irritate the horse. So it's a bit of a judgment call between you and your vet and your intended use of the horse, whether or not you choose to remove these. Canines are present in males, and they are sometimes present in females. They rarely cause an issue, but they can become sharp and they can develop a lot of tartar, which is just dental plaque that builds up. During the dental float, your vet can put a little tool that removes the tartar. And in the past, people used to try and float these down as they would become sharp, but we've now learned that this is not a good idea because you can really damage this tooth if you float it down, so most of the time we don't touch them. And this image is just to highlight how horses' teeth change in length and angle as they age. And so you can see that as the horse ages, its teeth become longer, and this is where the saying, long in the tooth, comes from. So what does all this mean? All this is just to say that equine dentition is quite complex, and that normal horses require an oral exam annually and a routine dental float to keep their teeth well balanced and healthy. So dentistry should be considered part of your horse's annual wellness program, and horses with specific dental abnormalities require floats or exams more often, such as every 6 months. The goals of floating are to create equal excursion side to side, and so excursion is just the way the jaw can move side to side, to maintain a good grinding surface for eating, to allow for natural chewing movement, and to maximize your horse's health and performance, which is what we're all after. Oops. So this slide is just to show the different types of floats that we have. There's motorized floats and hand floats. So prior to the invention of the motorized float, all floating was done with hand floats, and this was quite the effort. I'm very thankful that we now have motorized floats, and the most common one that you'll see out there is called the power float, and that was actually invented by our very own Dr. Rock, who is a world leader in terms of equine dentistry. And so these are our two options. The power float is very efficient and allows us to really do a lot more fine-tuning than we previously would have been able to do. A common question we get is, so what about wild horses? Why don't they need dentals? This is kind of multifaceted, but essentially we're not riding them. We're not putting a bit in their mouth. They're on a very natural diet where they're grazing 24/7, so we're not feeding them concentrates or hay, and they have a much shorter lifespan. So horses in the wild live on average 16 years. Obviously this varies regionally, but as you know, our domesticated horses were able to manage well into their 30s. And so it's the older horses that often really do get a lot of these issues. And once again, natural selection is always at play. So if a horse has a significant dental abnormality, they will not survive long enough to pass this on to their offspring. So how will you know if your horse needs a dental more frequently than 1 year? If you notice your horse dropping feed or quitting, this is when the horse does drop kind of balls of feed, and you might find these in the stall or in the paddock. If you notice resistance to bridling or taking the contact, abnormal head carriage while eating or riding, in addition to poor weight, poor hair coat, inability to chew carrots, having preference for eating hay before grain, taking a long time to eat, dysphagia, which just means difficulty swallowing, and sometimes chronic colic or a choke. So once you've determined that your horse needs a dental exam, you have the vet out. They'll start with a physical exam. They'll listen to your horse's heart to make sure that it's safe to sedate. If your horse has a murmur or an arrhythmia, they may recommend that we look further into this before sedating, because oftentimes it is an elective procedure, so you just have to weigh those risks. Also, we want to make sure the horse doesn't have a fever at the time of the dental. They should be healthy when the dental is performed. Dentals themselves create a little bit of bacterial showering in the bloodstream because there's so much bacteria in the mouth. So it is important to know that the horse didn't have a fever prior to the dental. So once we've determined that the horse is a good candidate for a dental on that day, we will give some sedation, place a speculum in their mouth, which you can see here, place a light, and then do a full oral examination. And at that time, figure out what kind of modifications need to be done on that day, and then we'll go ahead with the float. So the routine findings are the sharp points on the upper molars, which can cause ulcers on the cheek, and then the sharp points on the lower molars, which can cause ulcers on the tongue. We also commonly see rostral hooks, rostral meaning at the front of the mouth, and then caudal hooks at the back of the mouth. Other abnormalities we can find are fractures or diastemas. So a diastema means a space in between the molars where feed material can accumulate. And then fractures aren't always a problem, but if a tooth is fractured, this can lead to infection of the tooth all the way down to the root. And then this can lead us to another problem that we commonly see. It's a tooth root abscess, which can lead to sinusitis. So tooth root abscesses can occur because fractures, diastemas, overcrowding, and the important point is that some of the premolars and molars in the upper jaw are connected to the sinuses. And so if this tooth becomes infected, the infection can also spread to the sinus, and then we get sinusitis, which means inflammation and infection of the sinus. So the most common clinical sign you'll see with this is one-sided, thick, very, very smelly nasal discharge. And the diagnosis is made based on oral exam and radiographs. And if you have this condition, we have to remove the tooth, and then we'll flush the sinus and put your horse on a course of antibiotics. And then I couldn't talk about dentistry without touching on this condition. It's a bit of a buzzword these days, EOTRH. It's a mouthful. It's equine odontoclastic tooth resorption hypercementosis. So we like to stick to EOTRH. This is a syndrome that results in resorptive lesions of the incisors. It's not fully understood, but it is an inflammatory process. It's gradual in onset, and we are seeing it mostly in our older horses. It's often not diagnosed until it is a bit in the later stage, and the common clinical sign is incisor pain. So maybe your horse is not wanting to bite off a carrot, and it used to love carrots, or during the dental, your horse is really experiencing a lot of pain when its incisors are placed on the hard surface of the speculum. So it's definitively diagnosed with radiographs. And then as you can see in these radiographs, the significant absorption at the incisors. And so the treatment sounds barbaric, but we actually remove all of the incisors that are affected. And the horses do really well without incisors. They're able to go back to eating normally fairly quickly, and it really takes away their pain. So a lot of people will notice a significant change in their horse's demeanor and say, wow, now he is so bright, because we just didn't realize before how much discomfort the horse was in. So in summary, routine dental care is an important part of maintaining your horse's health in addition to vaccines and dewormers.
Yeah, and so then just tying this all together in a prospective plan for your horse, here's one example of what that could look like for the year, taking into account dentals, vaccines, and dewormers. So this is just an example of your typical pleasure acreage horse, and please take it with a grain of salt. This deworming schedule is very aggressive. We don't usually do this much deworming. And so an option here is to deworm in winter. We don't usually deworm in winter just because a lot of the parasites aren't out and about at that time. So come springtime is when we generally do our wellness exam. You'll have your dental evaluation at that time. You'll get vaccinated at that time before the mosquitoes start to come out. And then you'll get dewormed in the spring. You can also go into the late summer, vaccinate if you want to do later, but we prefer the spring. And you can also do another deworming in the summer as well, but most people wait till the fall, till after the first frost, because that's when different parasites come out and we can deworm them again for the most effective results. And with deworming, you can do fecal egg counts, fecal floats. We just bring us a manure sample and we'll look it under the microscope to see what parasites and how much are present there to see if your horse even needs to be dewormed or not. Because if it doesn't have that many, it probably won't be clinical, and then you don't need to get your horse dewormed as often as other horses. And so that is what we have. Thank you. Any questions?
Is there a cost to bringing in the fecal?
There is a cost to the fecal float. I believe I'd have to defer to,
Yeah, it's,
how much?
does anybody know what is a fecal?
We, on $35. Yeah, so you can bring us in a manure sample and we can look at it, or we can send it out too. Sending it out has an additional cost, but we do have the capabilities to look at it in clinic. Yeah, yes.
What do I need on my farm to do a dental? Do I need like a special stall or?
That's a good question.
I was just wondering what I need in my farm to do a dental. Do I need a special stall or a?
Yeah, what type of setup do we need to be able to do a dental? So ideally, we use head halters, so a rope that goes over a beam in the stall or something like that is most ideal. In dire circumstances, I have seen vets resort to a sturdy tree branch. Obviously, this is not our first choice, so we really do appreciate it if you can have, yes, some sort of area where we can hang the head and then access to some water, because we rinse the mouth before and after. In worst case scenario, let us know if you don't have the capabilities of having this set up, and then we can bring a dental stand or your assistant's shoulder.
Yeah, done that. Yes.
I have a question about the deworming in the fall. You talked about the spring.
Mhm.
What do you use in the fall?
Yes.
And the other question I have is some dewormers, if you have a dog that likes to eat horse poop, how long do you have to keep them away from it before it's?
Yeah, so the dewormers take a few days to take effect to go through. Would you say? Yeah, so if your dog likes to eat poop and you have a high worm load in your horse's poop, after deworming, maybe keep them away for a few days, just till that take effects. And then in the fall, because we're targeting different parasites than we do in the spring, we use a different product. So we use the Quest Plus or the Moxidectin, Praziquantel, those products, whereas in the spring we'll generally use ivermectin instead. And I'm just gonna go to this side of the room to see if there's any other questions. Yes.
So what would be the age limit that you would float teeth on like a geriatric horse?
I really don't think that there's an age limit. There's no age they reach where we say it's not appropriate to continue with dental care. As they age, they actually might increase, their frequency would increase, so maybe every 6 months as they age. So eventually their teeth roots grow out to the point where they don't have much reserve crown anymore.
Right.
And so at that point, yeah, it's a better idea to have dentals more often than not. Especially the older horses have difficulty keeping weight on. We want to make sure that they're able to get all the calories they can.
Because we have a horse that's 31.
Mm-hmm.
Thanks.
And winters are hard on him.
Yeah, that would be fine.
Probably have time for one more question.
How long does it take for the vaccination?
Yep.
I know usually you always have it in the fall or in the spring.
Mhm.
Is there a problem if they do kind of a year out in the spring, or sorry, in the fall?
Is there a problem if we vaccinate in the fall compared to the spring?
Yeah.
So the goal, the main thing, it depends what vaccines you use, but a lot of our vaccines for the neurologic diseases are transmitted with mosquitoes. And so if we vaccinate in the fall, that's not prime mosquito season. And so you can vaccinate in the fall, but the better protection is to do it in the spring, because then they have an immune response built up for when the mosquitoes come out in the summer.
So if you are, it's my daughter in the family, so, but she's vaccinating in the fall, and that's what I had mentioned, that it's better to do it in the spring. So would she be okay if she waited until the fall, or until the spring to get it?
Right now,
Yeah.
because winter is coming, it's appropriate, yeah, to wait till the spring at this point for her.
Yeah, I'm from Ontario, and sometimes in the fall we'll vaccinate with things like rabies, because Ontario there's so many small mammals, rabies really is a big concern. And so oftentimes we'll break it up that maybe we'll target rabies and flu rhino in the fall, and then more of the mosquito viruses in the spring, just to split it up.
Well, thank you guys very much. We're out of time.
All right, thank you, ladies. Great job. Great job. Next up, we have the famous or infamous Dr. Thompson. She's going to speak to us on your geriatric performance horse.
All right. Well, thank you very much, everyone, for attending today. And we're always really pleased to see a lot of the faces that we hear over the phone or speak to on the phone, but don't necessarily get a chance to meet in person. So it's nice to meet you all. I'm Dr. Thompson. I've been with the practice since I was a vet student in 2008, so it's been a little while. So today I wanted to speak with you about geriatrics and their athletic performance. So I am boarded in sports medicine and rehabilitation, so I run our rehab center down at our South Clinic location. And you know, as we all know, we want to try to keep our horses healthy for as long as possible, and activity, whether it's us as humans or them as horses, we know is actually part of their general health, so, or what's good for all of us. So this is an interesting topic for me. So in this picture, we actually have my son riding Tuffin, and he's 27 years old, and he was an ex-cutting horse, competition horse. The horse beside him, Izzy, is 17, and she also is a national cutting horse champion. So as we know, our horse activities may change over time, but it's still, you know, something where it's just as important to me to keep that horse going for my son as it would be to be working on one of the big Grand Prix horses at Spruce Meadows. So you know, geriatric medicine is definitely becoming more increasingly important in our field. There is, however, limited formal research on the topic. You know, with respect to management, preventative health care, disease conditions specific to elder athletes, there's actually a little bit, you know, more limited information available to us in the literature, even though we know that at this stage, approximately 10 to 26% of aged horses are being used in competition. So we see this everything from, you know, everything from, for example, Big Ben. So he was back-to-back world champion. He was, you know, the Demorier Cup winner at Spruce Meadows. He had numerous Nation Cup victories, over 50 Grand Prix titles. He actually survived 2 colic surgeries during his career. And then I got to work with him actually in his final year when I was at Spruce Meadows. And he was in a trailer accident that killed several horses, survived that, and 2 months later was back in the ring and actually won the Derby at Spruce Meadows at age 18 in front of 50,000 people. So, you know, if a horse is well cared for, the things that they can accomplish are actually quite incredible. Vallegro, for any dressage riders out there, of course, is very well known. At 14 years old, he holds, you know, world titles in all 3 Grand Prix divisions. He was both a 2012 and 2016 Olympic gold medalist. There's a few interesting stats about the 2012 London Olympics. So at that Olympics, I was able to pull a paper that talked about aged athletes specific to the Olympics. So of 74 horses that started, for example, in the eventing competition, 17, so that's about 23%, were actually over 15 years of age, with the oldest being 20 years old. And 2 of Germany's gold medal winning teams were 15 years and older. In the dressage competition, 24% of the 50 horses were 15 years of age and older, including 2 of the 3 medal winners. So the oldest dressage competitor was 18 years of age. So definitely not to be set aside in their importance in the field. Moving over to the Western disciplines, of course, there's lots and lots of examples. The one famous horse that people talked about is a horse named Sparky, who ran Pro Barrels and was still winning at age 21. He was the AQHA Horse of the Year, and he was only 14 one hands high. So a little guy, but quite the little speed demon, ridden by a lady who is 62. You know, so the 2 of them had a lot of fans as everybody put themselves in their shoes and rooted for them. And I myself got a chance to actually hit the cutting pen and compete, and I was so blessed to get the offer to ride Cody Sixcat, who is actually, I brought him back out of breeding retirement because he was feeling so good. the owners were gracious enough to let me get him fit again and head back into the pen. And so I learned a ton on that horse that I wouldn't have been able to learn necessarily on a youngster. So I have a soft spot for some of the elder athletes. And then in addition to that, I also got a chance to, this is like a hard horse for me. So Moose was a horse that at 18, I took him and then got him seriously fit and ended up competing in the ladies side saddle racing at both Millerville and the Calgary Stampede. And we won, both 18, 19 years old. We smoked the field, and he lives in a field right by my house. So I see him and I stop and finish my work phone calls before I go home and stare at him out in the field. And he had EROTH, so all of his teeth got removed by Dr. Lockhart. So I still take care of him like he's my own, and he's out there still bossing everybody around. And then last couple of fun little pictures. This is, Katie actually came over and side saddle race with us, but this is her riding Herbie. And she goes on the fox hunts and also competes in steeplechase racing, and her favorite hunt horse is 23 years old. So pretty cool stuff. Last but not least, just to drive home the point, thoroughbred racing, of course, is probably our maximal exhibition of a horse's physiology at push to its limit, right? And the competitiveness is second to none. In this field, though, there are still strong examples of, horses that, with good genetics, good maintenance, that are still, have won major races in their time. Of course, it's probably less common than the younger horses, but I think the industry gets a hard time about, use and disuse the race horses. But there are examples that if they, if they're successful and built right, they'll keep running for the owners, which of course is probably pretty popular. Okay, so let's define a few things. So, what is an aged horse? What is a geriatric? Well, geriatric, the term was first used in human medicine in the 1900s. And geriatric defines the life stage characterized by progressive decline in physical condition, organ function, sensory function, mental functions, and immunity. And as I sit here today, I think to myself as I was studying this topic, I was like, man, this is like facing my own reality. I don't know if I like studying this. I think I would prefer to live in bliss and not look in the mirror. But anyway, so the age to classify a horse as a geriatric, well, is slightly debatable, and it can be defined in different ways, including chronological age, demographic age, and physiological or functional age. And it's more physiological age that we will, focus on for the purposes of, from a veterinarian's perspective, because it considers the point at which peak physiological functions begin to decline. Okay, so let's delve into that a little bit further. This, actually, before I move on to that, I found this cute, kind of cool thing, because we always think of like knowing like a dog and a human, like 7 years difference, whatever, but this actually breaks down comparisons of human age to horse age. So for the first little while, it's quite a difference. As we know, our young horses still act like babies and are pretty immature. Up to the age of 4 years old, they're about equivalent to a 20-year-old who thinks they know it all, but probably still don't. And then after that, it does start to decline. So, for every fourth year after the age of after the age of 5, it's equivalent of about 2.5 human years. So they start to slowly, gain a little bit of maturity, right? And that's probably why they're, such good competitors at that stage. They've got things figured out a little bit more. So, okay, so demographics of the aged horse. It varies actually quite a lot between countries. There's limited information on population estimates and age distribution internationally. We've got more information in more of the westernized world, but it does seem anecdotally that life expectancy seems to be increasing with increased knowledge and increased care. Less horses in the workforce, so to speak, and so they're more companion animals that do get excellent individual care. It does also anecdotally appear that the proportion of aged animals in the population is increasing. And so from some estimates, some of the research I pulled up, they're saying, somewhere between the 10 and 33% of the population could be classified as aged. Okay, so we're going to focus on the changes that happen within the body associated with aging. So these occur subsequent to damage caused by intrinsic living processes. So natural, cell breakdown, apoptosis is actually a word that's used. Environmental factors, and then age-associated disease. These are all things that are going to have, effects on different parts of the body. So when assessing health and disease in the older patient, it's important to recognize and distinguish between benign signs of aging and physiologic changes with age, which can predispose to disease. And then differentiating that from actual clinical signs of disease that can be associated with aging. So it's a little bit of a vicious cycle, as you can hear, because many of these signs are non-specific. So accurately making this distinction between aging in horses can be difficult, and changes frequently considered benign signs of aging, for example, musculoskeletal stiffness or reduced joint flexibility or exercise intolerance and fatigue, can actually represent clinical signs of disease. So it's very important that we have this awareness that not just everything going on with the horse is, oh, it's just because they're getting old. So oftentimes things are maybe, chalked up as that when they could actually be investigated and figured out as an actual disease item that we have, strategies to improve the quality of life for the horse or their performance in this talk. And so it's something that's definitely needs to constantly be in our awareness and be a working discussion. So I'll kind of skip through these a little bit faster, but of course when we're thinking about the physiological alterations associated with aging, we'll go through the different systems quickly, but we definitely have cardiorespiratory changes that we know decline with time. So there's going to be automatically an age-related decrease in your maximal heart rate that your heart can attain. You're going to have a decrease in your maximum stroke volume, how strong your heart is with every beat, how much volume of blood can be pushed by your heart. And then you'll have a decrease in your VO2 max, which is the maximum volume of oxygen that your blood can pump through your system given a certain amount of oxygen that you were starting with. So that's an actual test that's done as a measuring stick in human physiology or human exercise physiology, and it's a benchmark that we're also trying to achieve. Dr. Renaud Lagilette's been quite involved with actually trying to get these measurements in horses. And all of these things are actually reached at lower speeds. Of course, less intense exercise causes these things to hit their max sooner. There are some physical lung changes in older horses, although it's the actual clinical importance is unknown. So, but you can talk to me more about that if you like. And then many of the age-associated changes in this cardiorespiratory capacity is actually not found until they're older than 20 years old. So I found that very interesting. So now I feel a little bit less bad making Moose get fit and race for me at 18 and 19. He did great as I demonstrated, but despite the reductions in older horses, they still can show improvements, of course, in their maximum stroke volume, their VO2 max with training, which again, Moose nicely demonstrated for me. So one of the other things that does change with age is thermoregulatory changes. So they end up having a decreased ability to thermoregulate during exercise, and they reach higher core body temperatures more rapidly. So that's something for us all to be mindful, especially when we had a hot summer like we did. And the idea of going for a nice long trail ride out west is great, but we just have to be a bit cognizant of the fact that they can suffer from heat stroke, etc. And this is likely due to the fact that they actually have a lower plasma volumes. That's the fluid content within our blood. They have a decreased resting circulatory blood volume, as well as a decreased resting actual red cell volume as compared to younger horses. Then, of course, we've got changes in our musculoskeletal system. So we have a loss of muscle strength that happens over time, which is due to the atrophy or decrease in both the actual numbers of muscle fibers that are within the muscle. There's a reduction in the type of muscle proportions of aerobic. So there's type 1, type 2, different types of muscle fibers that are elicited for different types of muscle activity, whether it's endurance longer type or burst, quick type of activity. we actually end up over time losing the aerobic type fibers, in addition to decreasing in some of the enzymes that are responsible for having our muscles function. So overall, you end up with a slightly lowering exercise capacity over time. Everyone, of course, very common topic in my world is my horse's top line isn't looking great, and how do I improve my horse's top line? And yes, these are things that you will actually get muscle loss over time with aging alone. Although there's a lot of things that can be done in terms of exercise, core exercises, saddle fit, equitherabands, things like that can actually get you basically more bang for your buck or more bang for your time. How can we, if I've got an hour to work with my horse today, how can I maximize that time to meet some of the goals that I'm trying to attain? We'll get into that a little bit more. So this is a little bit wordy, but I'll just quickly introduce some of the words because they're even important for us, in our own knowledge base. So immunosenescence, that's a decline in our immune system that happens over time. So we know that there's a drop in white blood cell count, especially a certain type of white blood cells called lymphocytes, as well as their function. We know that, as they alluded to in the talk prior to this, that there's actually a reduced response to some vaccines. So it doesn't mean don't bother vaccinating, and we know that even though they might not have as high of titers or a measurable response to a vaccine, we know that the vaccine does still confer protection from clinical disease or reduce the severity of the clinical disease. So as we know, when our elder patients start becoming a little bit more immunocompromised, it's actually still very important to vaccinate them, not say, oh, well, they're old, they built up a good immunity at this stage, forget it. So anyway, food for thought. Then the next concept is inflammaging. So that's interesting to me as well. So with age, we actually have an increase in the pro-inflammatory cytokines. So just think of these things in your blood, in your joints, and everywhere, cytokines and other mediators that put us in a more inflammatory state. Which ends up having effects on how you feel, how your joints feel, how your gut is functioning, et cetera, et cetera. So this pro-inflammatory state affects the horse as well. And so there's things that we'll be talking about as measures to help decrease that. So in human studies, overall working capacity we think decreases with age. But then there is quite a bit of research pointing to the fact that some of the declines in exercise capacity in older humans is actually related to a decline in physical activity rather than physiologic aging. So there's lots of examples of elder athletes that are able to put their mind to it. They're not superhumans. They're just people who basically are trying to maximize their abilities just like any of us could. So I find them quite inspiring. I did have to laugh a lot though. I don't know if any of you have seen. There's a Netflix movie right now called Naiad that's about this woman on the right who she tried to swim from Cuba to Florida in her 20s and she didn't succeed. Well, time marched on and she just was so annoyed that she didn't do it. She decided to, at age 61, embark on it again. And I think it was on her 4th or 5th attempt that she finally made it happen. And what made me really laugh and think that I'm starting to get old is that I kept falling asleep watching the movie, and it took me I think last night was about my 5th attempt of finishing the movie, and I finally did, and I got to the end and was kind of cheering to myself, and I was like, oh my god. Even the fact that I think that's funny is proving I'm getting old. Anyway, so common conditions affecting the aged equine athlete. We know that the prevalence of owners reporting conditions going on with horses aging increases. Their phone is ringing, we're getting more appointments booked about people concerned about their older horses. We know that increasing age is a risk factor for specifically chronic laminitis, strangulating lipoma, which is like a fatty tumor on a string that can wrap around the small intestine and be a significant cause of often surgical colic, so a scary one. Equine asthma, which we're going to have more discussion about that later today. It's also increased risk, aging's increased risk for cardiac murmurs, specifically mostly on the left side of the heart, as well as eye conditions. I won't go on about that in detail right now due to time, but I was very, very interested to read about horses like over the age of 15, something like 90% end up having, eye problems. So I think it has even heightened my awareness that just because I go and see a horse with a bit of a dripping older eye or whatever, that it's something I really need to pay attention to. And it does affect, if something flares up right when I have a horse trying to show at Spruce Meadows, in the Grand Prix ring, and it's an FEI horse, it's a problem. So my older athletes, I'm starting to really be on it, especially in the off season, with making sure that their eyes are in good condition as well. So the girls talked about this earlier today. They went through, the dental disease. So I think we'll not belabor the points there. I did throw this in just in case they didn't cover this topic, again, because it's close to my heart with Moose needing all his teeth being removed and me wishing that I had figured that out maybe years prior. In his case, it was more advanced, and I was almost heartbroken when I went back to do his dental and he had some loose teeth. So now I'm a little bit more on the lookout for that earlier. But still, it's a big part of our care. Of course, musculoskeletal disorders, that's like bread and butter in our industry. So it's among the most common reason for people picking up the phone and worrying about their horses. Also on, the end of life, it's one of the most common reasons that people start feeling like they're feeling sorry for their horse or worried about their horse, and that they end up euthanizing their horse just based on feeling that their horse isn't comfortable anymore. Most common, of course, would be osteoarthritis, which is about 40% of the causes of disease in our older horses. And others, though, it didn't talk about this in the one of the really good resources I was using, but it's remiss to not talk about ligaments and tendons. In the rehab side, that's what I deal with constantly, and older horses are definitely more predisposed to repetitive injuries. If they get a severe injury, lack of ability to heal from that. So that's a big topic I deal with a lot. So of course we know that osteoarthritis, we end up having to change, the horse's regimen a little bit to manage it, but it's really important to understand that we see, it's on a spectrum, and there's so many more management tools that we have available to us today than may have been, previously available. I know even in my mom's era, like the thought of injecting horses was considered like, oh, I don't want to do that, it'll make the joints worse, and and we should just retire her. And I just think of the horses I grew up with that, man, if I'd been their vet now, they would have been still going for years. And there's products that are definitely not detrimental to the joint. If anything, there's strong arguments to suggest that reducing the inflammatory soup in joints can actually help decrease, cartilage damage, et cetera, et cetera. So we're very quick with a lot of options at our fingertips to get horses comfortable, intervene sooner, things like that, that really does extend the comfort and utility of the horse. So again, we'll not go into osteoarthritis in too much detail here, and this is, again, we can talk about it in more detail at an individual level or what have you, but we've got a lot of, as I said, a lot of options available to us. Cardiac disorders are on the list, of course. As horses age, cardiac murmurs are more frequently detected. Luckily, they're often incidental findings and benign things, so nothing that's going to be too scary for the horse or the rider's safety. With age, it's mainly the aorta, aortic valve, and the mitral valve on the left side of the heart that ends up having insufficiency or a little bit of regurgitation where the blood is flowing back and it's not a tight seal. And we know that the heart murmurs are affecting about 20 to 30% of our geriatric horses. We're going to hear a lot about this later, but respiratory disease, of course, major effects are on the lower respiratory tract, and they have a cumulative effect over the lifetime. So that's even, my son, who's almost 7, he has asthma, and there's a ton of correlations between humans and horses, a lot of similarities. And the doctor is telling us, yep, nope, he needs to stay on his puffer, even though it's only his lower airways. And I'm like, can't I get my kid off this? And she's driving home the point that the whole point of treating them early is so that it doesn't progress over time, that it doesn't cause chronic scarring over time. So I think by the time we've got elder athletes, it's very, very, very important to think about lower airway disease, even if it is at a subclinical stage. By the time they're coughing and whatnot, you've got to think of it as like, the tip of the iceberg, that there's a lot more happening down at the lung level. So we do a lot of diagnosing of this, a lot of awareness, a lot of bronchial alveolar lavages in an attempt to address this. And then last but not least, I touched on one of the endocrine things, which is Cushing's disease. It's a dysfunction of a part of the brain called the pituitary gland, and more than 20% of horses over 15 years old have it. And then one paper by a famous internal medicine specialist, Dr. McGowan, actually said that for each year over the age of 15 years of age of the horse, 18% increase in the number of horses with Cushing's. So basically, and even at the rehab center, if I have a horse with a wound that's going to be needing, a 6-month recovery from a big wound, I end up wanting to test them for Cushing's because it's something that can, suppress their healing capacity. So that we know some of the clinical signs. If you look at this classic little photo, we've got delayed or absent shedding, lameness, lethargy, weight loss, altered fat distribution, lack of muscle, so muscle wasting, especially along their back or apaxial muscles, increased eating and drinking and urinating, patchy sweating, and increased susceptibility to infection. So a pretty major list of things that we would like to avoid if you don't all agree. So what are we going to do about this whole aging business? And how are we going to keep our equine athletes, functioning for as long as we can? Well, it's going to be a combination of exercise plans, nutrition, routine preventative care, which we've alluded to in other parts of today's talks, and then performance or soundness evals. And I focus on lameness, rehab, all of that, but a critical part of my year of feeling like I'm a team member and helping advise clients and help make decisions for the horse and plan out the whole year is at that first visit, the spring health. And so sometimes, I'll bring another vet with me and we'll, together get their dentals done, but it's really my time to see a snapshot of the horse and make some goals, hear the owner's, plans for the year, and then really map out everything from their, routine care to how are we going to address some of their physical issues. So last but not least, some of the principles of managing these aged horses is that, I've said it many times already, is that it really takes a team because every single person involved with the horse sees them, through slightly different eyes, whether it's the person cleaning the stall noticing that they're not finishing their feed, or that they're, were reluctant to go to their turnout pen that day. So it really does take a team approach to have the best success with our aged athletes. Secondly, downtime can be counterproductive. So, they'll when they lose their strength, they lose their cardiovascular fitness, it's more difficult to get it back. So the philosophy of, move it or lose it definitely still applies to older horses. And if they can maintain a certain fitness level, they will definitely last longer. Third, physical problems are best confronted quickly. So I even teach little kids when they're learning how to ride at our place that their job is to be a detective. So they might not know what it is or what to do about it, but their job when they're grooming their horse is to notice stuff. And I think that goes for everybody. The better you know your horse's legs, their attitude, disposition, then you're going to be able to pick up on some of these things sooner and be able to deal with things. Like we said, we don't want our older horses to have time off, et cetera, et cetera. So quick intervention is important. And then aging requires continuing adaptations. What I meant by that is that we're going to adjust how much we use the horse, which events we might choose to have them compete. If it's an older horse that doesn't thermoregulate well, I might think about, commenting if they're going to go compete in Florida with that horse when they're not, accustomed to that. So there's a lot of planning and adjusting of their schedules that we might pick and choose based on the footing or the ground if they have a certain injury. So it's really something that, the rider, the trainer, everybody, we work together and constantly are adapting what's the best plan for that aging horse. And then finally, as we've mentioned earlier, healing is slower and less certain in older horses. So if we can avoid some of the problems in the first place, we'll have greater success for longer. So with that, I will field any questions. And there's Tuffin on a cattle drive with Healy again. So, okay. Go ahead.
I'm wondering if horses are impacted by hormonal changes as they age.
Yeah, so I did do some reading. So there's definitely testosterone drops some of the thyroid glands also drop, and there is some interesting work on somatostatin and things like that you can, we know, well, they're banned, but you can actually give anabolic steroids as well in certain cases, but there are consequences of all of those, so it's not something we generally use. But thyroid, Dr. Hannon can probably comment a little bit more from the internal medicine side, but it is insulin levels, things like that are things that we're also cognizant of. So yes, in short, yes, there are some changes, but it's not a major topic of treatment approach, I guess I would say.
So for mares, it's not like humans, where, there's.
Well, they go, I mean, there's examples of mares being bred pretty late. I think it's more irregular over time.
Yeah, we don't seem to see the hormonal estrogen changes as much. Definitely, like as they get older, they're maybe not cycling as regularly and not fertile, but as far as other health issues, not really.
Suggest for like an older horse for their food, their diet, their diet and, maybe helping to prevent these things?
Well, of course, that's probably a very open-ended question because I think the key is tailoring it to the specific needs of the horse. And I would just start by keeping things simple as calories in, calories out. So what is the horse actually doing? And therefore, what does the horse require to stay alive? And then on top of that, we'll be having to add. And I think, you want to think of good quality food because maybe if their appetite is decreasing, every, calorie that they have, you want to be bioavailable, absorbable. So high quality feeds, I think is probably as important as what you're feeding. And it's a massive topic of discussion. So I think that, when I was listening to the girls do their dental talk and the vaccines and whatever, that point of service when we're there just doing a vaccine, there's so much stuff that's happening intuitively as the vet. You're looking at hair quality, how are they moving, like all of these things you're seamlessly assessing when you're there. And so I guess my answer to your nutrition question is book a vaccine appointment with your doctor because you're going to have one-on-one time to bring up and answer many of the questions that you have that are common questions, but we'll be able to deliver an answer that's directed to you as an individual and your horse on your facility with what feeds you have available to you, etc. So tailoring the care is what you're able to get as you book an appointment.
Say like oats, good oats and
Mhm.
carrots
Yep.
from
Yep.
there.
Next question. Exactly. Yeah.
Can you talk a little bit about an exercise plan for a geriatric horse? I have a 18-year-old with navicular disease,
Mm-hmm.
and so I've left him alone, and he's kind of
Mhm.
quirky, and
Mm-hmm.
I go out.
I think my answer is going to be the same, which is, we come to you with a lot of different ideas and a lot of different experiences and perspective. So that's what your vet offers you. And when you get us as a booked appointment, then we can tailor that experience level. And so each of us has our own scope of practice, but we also have a very good network. So I mean, we're a little bit like your gatekeeper to, hey, okay, let's figure out what your concerns are. Do I have the skill set to deliver it, or who am I going to call on my call a friend? And that may differ case to case. So next question at the back there.
We keep our horses forever, so I've had several toothless ones over the years.
Yep.
I'm wondering if you have seen a correlation between fecal water syndrome and toothless horses. Because we've had two that live on pasture.
Yep.
And they have fecal water syndrome.
Yep.
And we moved them to MASH and it just went away. So I'm wondering if you've had any experience.
So I'm going to defer that to Dr. Hannon, who's our internal. But for all of you, if you're like me, fecal water syndrome, I didn't even know what that was, and I'm a vet, not that long ago. So yeah, so it's a condition that horses end up essentially not being able to retain all of the moisture that their colon should be retaining to produce, the firm manure that most of us are familiar with. And Jillian, maybe I'll ask her to just make a comment or something at the end if people have more questions about that. But in answer to your question, possibly to do something to do with dysbiosis or the, you know, the microflora level that would change with a dietary change, but I would have to ask Dr. Hannon if she can comment further. Up front row here.
Would you say that because of the forest fires or the wildfires were so bad this year, that a lot of horses that are outdoor probably have asthma?
So there's a good capacity, like the surface area of the lung is obviously massive. So thanks be to that and our immune systems, there is turnover of cells and the ability to heal from insults. So most horses would not switch over into having any sort of compromise where they're getting constriction of the airways and constant mucus and things like that that affect them and actually classify them as being asthmatic. But they would have gone through a phase that if we had done lung washes on horses exposed to smoke, 100% they'd be having an inflammatory reaction, and very well they should. That's what's protecting them. But they wouldn't cross over into staying in the clinical side of being an asthmatic, if that makes sense. Yeah.
Let's do one more question, and then we'll take a little break.
Sure.
What are your recommendations besides the Adequan and the Legend for our older horses that are having arthritic changes?
So yeah, what I say again, so I tailor it to the appointment. And one of the things that I look at is I try to ask myself, okay, what is the horse doing? What do I see as its major primary problems? A high motion joint versus a low motion joint. What are they going to use the horse for? And I come up with sort of a problem list in my mind and try to match that with what the expected use of the horse is. And then the next major thing I look at is budget and feasibility. Who's feeding the horse? Who's out there? How much money do we have to spend? And I try to be your gatekeeper of where we're going to spend your money. And that may differ case to case. So, you know, yes, if I have unlimited budget, it's going to include nutraceuticals, good quality ones that, you know, you get what you pay for. So they're going to be on a supplement. We're going to be using, you know, systemic Adequan Legend. We're going to be doing joint stuff. They're going to be on high quality food. They're going to, you know what I mean? So I break it down by what's my problem list, what's my budget, and what's the feasibility of actually delivering it. And then we make a plan. So it varies case to case, but luckily we have a lot of, you know, tools in our toolbox to turn to. All right, well I think.
Yeah. Well, thank you, Dr. Thompson, and then. All right, everyone, we're going to get going again. Okay, so next up, we have Dr. Jillian Hannon. She's our internal medicine trained specialist. She's going to talk to us about equine asthma. You know, this is something that's really common. It's also quite complicated, and she's going to explain it very simply to us all. She has some nice little props on the side that I'm going to help her demonstrate. And here's Dr. Hannon, the nicest Dutch person I know.
Some people would beg to differ. Can everybody hear me okay? Yeah, that's perfect. Okay, well, thank you so much. As Dr. Berzowski said, I'm Dr. Jillian Hannon, and I deal with a lot of internal medicine stuff. So if you see me, most times your horse has been sick or has an internal medicine problem. So what we're going to talk about today, I'm going to first start off with some fun facts, and then Dr. Berzowski here will be my Vanna White and hold up some specimens. And then I'm going to obviously talk about, well, what is equine asthma? We're going to talk about clinical signs, how do we diagnose it, then of course, how do we treat it, so management and our different treatment options. So the first fun fact that I'm going to give you is that the horse can only breathe through its nose, which is obviously different than us people because we can breathe through our mouth as well as through our nose. When a horse is at a canter or a gallop, the horse will take 1 breath per stride, which is pretty impressive because, as you can imagine, they obviously need a lot of oxygen when they are going fast. When a horse is jumping, they will actually hold their breath and they will only breathe out after they land after the jump. And if we expand the airway and we open up the lungs completely and we lay it basically in a continuous fashion, the amount that is going to occupy is about the equivalent of 10 tennis courts. So it's a massive organ that is compressed into, well, the chest cavity of the horse, which is actually quite big. So Dr. Berzowski is just holding up a model of a horse's lungs. So in the center we have our windpipe, and then on both sides we have our left and our right lung tissue. When we talk about lungs, we obviously need to talk about the heart, because the heart is the one that actually pumps the blood with the oxygen to all our tissues. So the average weight of a horse's heart is about 10 pounds or 4.5 kilograms. And we have a specimen of a horse's heart here as well, which Dr. Berzowski will hold up. The resting heart rate of a horse is between 28 and 40 beats per minute, so fairly low. Our humans are typically between the 50 and 60 beats per minute. When we are going full bore, or we're racing, or we're cantering or galloping, a horse's heart rate can go up to 200, 240, sometimes even exceed 240 beats per minute. So obviously, you can imagine that big of a heart pumping 200 times per minute. And then the average horse, so I'm talking about a 1,000-pound or 500-kilogram horse, has about 35 to 40 liters of blood, which is obviously a lot of blood that has to get oxygenated by our lung system to provide oxygen to all our tissues. Those were my fun facts. So now we get into the good stuff. What is equine asthma? Well, the true medical explanation is that it is a chronic, non-infectious, inflammatory, obstructive lower airway disorder. Well, what does it actually mean? To make it basically a little bit more simple, we can think about our respiratory system as a tree, with the tree trunk being our trachea or our windpipe. Then we have our branches of the tree, that is where all the smaller parts of the air go. And then our leaves or our tree buds is really where the oxygen exchange happens. So when we're looking at our horse model, we can see the windpipe, is about 5 centimeters wide. So actually quite small for the size of a horse. And it goes to the deepest part of the lung, about 2 millimeters. So there's a lot of getting from big diameter to smaller, 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 smaller. So think about it as a tree, basically. And when we think about, well, what is the function of the lung? Well, the function of the lung is to have oxygen exchange and obviously get rid of our CO2 or our waste. So the only way, or the only spot where oxygen exchange is happening is in those tree buds. So very, very deep and in the very, very small parts of the airway. So we are obviously breathing in air, we are breathing in oxygen. That oxygen goes into the bloodstream, and then our CO2 comes out of the bloodstream into the airway, and that's what we exhale. So obviously the lungs are a very important part of life. So when we have a horse with equine asthma, we are thinking about this tree, and then we are thinking about, well, what has gone wrong with this tree? And basically what I just want to note as well, a lot of the people here will probably have heard the name COPD, HEAVS, IAD or inflammatory airway disorder, or RAO, recurrent airway obstruction. Those are all the old names for the past 50 years that we have named equine asthma. Now we basically have this umbrella term, equine asthma, and we divide the disease into mild, moderate, and severe. So coming back to a horse that has equine asthma, what is happening in those airways is multiple folds, but the major thing is that there is lower airway inflammation. So that means around our tree trunks, that space that is there before it goes into the bloodstream, that oxygen exchange where that's happening, that tissue is much thicker than it should be. Also, we get an obstructive disorder, meaning we get constriction of those airways. So as I mentioned before, the deepest part of the airway is only 2 millimeters wide or open. So if we already have thickening in that area, and now we have constriction happening as well, you can imagine that my air doesn't even travel that deep to actually get to those spots where oxygen exchange is happening. So again, I'm going to have to breathe more and heavier and deeper to actually get what I need to get, because what do I need? I need oxygen in my blood. And also, we have a lot of mucus production, so we're plugging up those airways as well, which, if you can think about it as you're on a road and you're hitting speed bumps, how slowly does that make your travel to work go? Well, a lot slower. So all of a sudden, I'm hitting also these speed bumps because we have mucus plugs in those airways as well. So the main issue that we have in horses is, well, why do they have equine asthma? And different factors, but basically there is a genetic basis. Some breeds are more susceptible, but basically we're always exposed to triggers. And then the biggest triggers in horses is dusts, molds, pollen, spores, smoke, ammonia. There are a couple other ones. Some horses are allergic to latex, for instance. So if you have a special barn with footing that has latex particles in it, that can actually trigger a horse. So horses can be, susceptible to multiple different triggers, but I would say those ones are really the ones that we see here in Alberta. And this picture just depicts, again, when we're standing in the barn, if the light is coming in, you're looking at the dust particles just floating around. And sometimes we can visually see them with our eyes, but a lot of these triggers we can't actually visualize. They're so microscopic, they're so tiny, that we can't actually tell that they are in the environment. And then this is just a picture depicting what is happening in the airway. So this would be our normal deeper airway, so we're all the way deep in the lungs. So in the middle, shaking here, in the middle, this is difficult. Even with two hands, that's why I'm not a surgeon. So in the middle is where our air is. Then we have our wall. So that's where the cell is going to be like, give me oxygen, I'll give you CO2 in exchange. And then on the outside, we're going to have our blood vessels, and that connects to the rest of the whole body. So again, when we have a horse with equine asthma, we're going to have thickening, so inflammation of that tissue, making it much more thick, again, making it more difficult for that oxygen exchange to happen. We're going to have a spasm or a bronchospasm or bronchoconstriction, however you want to call it, making that open airway much smaller because now we're in a spasm. And then you can think about having this little hole also plugged with mucus. So it really is kind of threefold as far as what is happening and why horses have so much trouble breathing when they have an asthmatic flare-up or an attack even. So which horses are susceptible? Well, unfortunately, all horses. So when I'm looking at a horse for coughing, poor performance, what have you, they could be a racehorse, they could be a jumper, they could be your trail riding horse, they could be a dressage horse, barrel racers, and then your pasture pets or your old retired horses, which now we learned from Dr. Thompson, we should just not put in the pasture. We still need to keep them active. But basically every horse that I encounter for equine asthma falls in any of these categories. So it's not just the racehorses or it's not just the barrel racers, it's really any of our horses that can be susceptible to it. So a little bit about clinical signs. I would say the most common clinical sign that owners will pick up on is coughing, nasal discharge, which could be from a clear watery type nasal discharge to a white foamy discharge to even a little bit of yellow or green. And then exercise intolerance. So basically not being able to perform what you would expect your horse to be performing for. So if you normally can, trot 20 minutes just fine, and all of a sudden you notice, well, after 10 minutes, he's really huffing and puffing, he doesn't even want to go forward, then we need to think, hey, this is something that I'm not really expecting. Other clinical signs that we will see when the asthma is a little bit more severe: nostril flaring, having a heave line, having increased abdominal effort, having potentially increased respiratory rate, and obviously having weight loss. So weight loss comes into play when a horse is quite asthmatic because all they are thinking about is breathing. Therefore, they're not thinking about eating. So a horse is also using a lot of calories when they are trying to breathe. and they're basically doing ab crunches every day, all the day. That's why they actually have that heave line, which I'll point out in the next slides. So weight loss is definitely something that you have to consider as well, especially I would say in the horses that have more chronic and more severe clinical signs. Just let this video go for a second. So it's windy, that's why the noise is there. But what I want you to see, and maybe, I don't know if I can shut off the noise for a second. What I want you to see is how this horse is breathing. Specifically, right there. So we call this type of breathing increased abdominal effort. So a horse should normally not be breathing in or out really with their abdomen. So every time that this horse is breathing out, you can see that the belly is going inwards because it's pushing with its abdominal muscles to get air out of its system, which normally is a passive movement and should not involve the abdomen. And then also you will see that line, that heave line develops right there. So that's where the chest and the abdominal muscles meet, and that's what that heave line is called. So if you have a horse with a very pronounced heave line, you know that at some point in its life, he has been doing a lot of ab crunches, which if we were human, great, because we have abs. But in a horse, they don't need a heave line. That just tells me that he's been in some respiratory compromise. And this is the same horse. Now we're inside, so it's not as windy. And now I want you to focus on, again, its abdomen, but also on its nose and its eyes. So you must have heard it, but you can hear the horse just wheezing, and you don't even have to stand that close. We're looking at our nostrils. They're basically flared the whole time. When we looked at the eye of the horse, the eye is actually quite stressed. It's not a nice and soft eye. The horse is still eating, but it's basically eating like this because it is quite stressed, because it can't breathe. And again, we saw that abdominal push, that abdominal movement of trying to breathe. So that's a horse in an acute kind of asthma flare. So when we're talking about diagnosis, there's kind of two different mechanisms of diagnosing a horse with equine asthma. One is based on just clinical assessment. So I'm looking at what is my cyclement, how old is the horse, what type of horse is it, etc. I want to know history. How has the horse been housed? What does the horse get fed? And obviously I want to make sure that the horse doesn't have any other disease, for instance, a pneumonia or a bacterial pneumonia or viral pneumonia, because obviously any type of respiratory disease can affect the lungs. So I want to make sure that I'm obviously not dealing with a horse with pneumonia, but they are typically very different. They will have a little bit of a different history. They will have some different physical exam findings as well. So therefore, knowing, okay, what is most common, what is less common, and then also, am I looking at a sick horse, or am I looking at a horse with equine asthma that is not particularly sick, but we just have a lot of inflammation and gunk buildup basically in our airways. So our physical exam is really going to be helpful. And one of the things that we do, in addition to listening to our normal auscultation of the lungs, we also do what we call a rebreathing exam. And a rebreathing exam is basically the same thing as your doctor telling you when he is listening to your lungs, take a deep breath. We can do that on command. A horse cannot. So when I'm wanting to listen to the lungs, I'm going to make him breathe into a bag. That makes him breathe slower and deeper. And that means I can hear much more in our airway and our trachea than I could normally hear. And then the vet might want to do some blood work, especially if they're a little bit concerned that there might be some illness going around. Not always needed. And then I have a clip of an auscultation of a horse that has equine asthma. See if we can hear it. Did everybody hear that? So again, normally when we are listening to the lungs, we really don't hear a lot. We just hear air movement. We should not really hear that kind of wheeze. Sometimes we hear a crackle. Sometimes we hear a lot of fluid going back and forth. So it is very important to do your auscultation in a quiet environment, because obviously if there's a lot of rackets going around in the barn, or you're standing out in that windy field, you're not going to hear anything. So auscultation is very important to do in a nice and quiet environment. The definitive diagnosis is based on endoscopy and or BAL, or lung wash, as Dr. Thompson alluded to a little bit. So endoscopy is basically a camera that goes up the nose, into the horse, and I'm looking at the upper airway and I'm going down the windpipe. So why do I want to do an endoscopy? Well, I want to rule out just making sure that we don't have an upper airway problem. And then I'm going to look in the trachea itself, so this is the windpipe, and I'm going to look for tracheal mucus. So as I mentioned before, horses with equine asthma have that lower airway inflammation, they have the bronchoconstriction, and they have the mucus buildup. So I can already see mucus in the big airway, because this all comes from the lower airway, the small airways, because the horse is trying to get rid of it, right? And then I go down as far as where my lung splits into a left and a right side. So this is called the carina. There's a lot of cough receptors in this area as well. And horses with equine asthma, as I mentioned, this area here also gets thicker. So I can actually evaluate if this tissue is more, quote unquote, inflamed or thick. My BAL, or lung wash, basically what I do is I have this long tube that goes up the nose into the airway, and we're going to go to the deepest part of the airway as much as possible. Then I'm going to make a seal with a little balloon. I'm going to infuse saline, and I'm lung washing, or washing the lung, if you will, and I'm sucking that fluid back out so that I can evaluate that. So this is our white tube that goes all the way up into the nose, into the lungs. And then here I'm sucking with my syringe, I'm sucking back my saline that I put in, because I basically washed that part of the lung. Then I have my BAL fluid, which looks like this. So I want to have a good sample, meaning I want to have a sample from deep in the airways. If I just take a sample from the trachea, that doesn't tell me anything about what's happening deep in the airway. So that's why a BAL is needed. And I'm going to see this white foamy layer, that is the protein that is, again, deep in the airway, so I know I was in the right spot. And then I'm going to have my BAL fluid. Then I'm going to send that to the lab, and we're going to look under the microscope to what our results basically show. So I have a couple different examples of BAL results. And the one thing that I will want to just point out in these examples is we have normal reference ranges for all. Horses with equine asthma are going to have an increase in mast cells, eosinophils, or neutrophils, or they can have an increase in all of them. They can have an increase in just one of them or two of them. Doesn't really matter. What the gist of this story is that all these BALs, even though they are all different, they are all equine asthma. So those three cell types are the ones that I'm looking at, particularly when I'm looking under the microscope. So then we come to management. And why is management key? Well, one thing that I didn't tell you in the beginning is when we are seeing all those changes in the lungs, if we basically just let that fester or let that go on for too long, my airway is going to what we call remodel, which means my airway is going to change over time to the point where we cannot reverse it anymore. So if you think about lung tissue, it's super elastic, it's super compliant, right? It has to make all that movement. versus a lung that has been in a chronic inflamed state is going to get stiff and it's not going to get compliant anymore. So at some point, and we see this in our super old asthma horses, you give them all the management, you give them all the treatment, but they actually don't see relief anymore. And that's because their lungs don't respond anymore, because now we have stiff old lungs that actually don't want to breathe anymore. So management is really key because, again, the triggers are environmental. So if we can get the management as best possible, that's really what is going to help your horse long term. So what we want to do is obviously remove or decrease exposure to triggers. This is what I see a lot, and again, that's because this is how we house horses. They're out in the field in a round bale. Well, being outside is good compared to being inside in a stuffy barn, but then I see this happening because our hay nets are broken and they just stuff their head in there and they're there. They don't come up for air for 10 minutes. They're just, nibbling away for hours and hours on end because they have that access. So when I see this, one thing I don't like is obviously that it has holes in it. Technically, round bale hay is quote-unquote worse than square bale hay as far as the amount of dusts and molds and all those types of things. But again, we also have to think about it from a realistic standpoint. What can we change? What can we actually feasibly do at your situation? But if I see this, then obviously I want to address that for sure. So potential options are removal of hay, going to steamed hay, or going to stoked hay. Again, especially in those horses that are quite severe. There's obviously a that I like to use quite a bit is the Hoffman's Hay Saver and Jenna Pro from the Trout Nutrition brand. Those are what we call complete hay replacement pellets. So for whatever reason, if your horse can't eat hay or cannot have hay, you can feed this and that will be exactly the same as feeding a horse hay. Soaking hay, there's always a little bit of confusion as far as, how do we soak hay? What is the goal here? Again, I'm talking about equine asthma, so I really just want to decrease the exposure to dust, molds, pollens, all those types of things. So I want to soak it in cold water for 30 minutes and then feed it wet. Another option is going to steamed hay, and there's different, hay steamers available. At More Equine at the clinic, we have a Haygain hay steamer for the horses that come into the clinic that need to eat steamed hay. But you can also build your own because YouTube is there for a reason, and you can find everything on YouTube. So you can easily build your own hay steamer as well to be a little bit more cost effective because obviously any type of commercial product is going to have a little bit of a cost picture to it. Some other points that I want to point out is if they are in a barn, we don't really want any hay or straw storage in the barn. That just makes the barn much more dusty. When we are cleaning the barn, we really don't want to be sweeping, mucking out their stalls, feeding the horses when they are actually in the barn. If you are in a really dusty spot, just doing with a little bit of a spray, just making it wet it down so that when you're sweeping, you're not really picking up all that dust. It kind of stays low level. Example here, and if you looked good, she's obviously sweeping, but there's a horse right there. So this picture is actually depicting what not to do, because I want my horse to be outside, ideally. Ventilation, which again, most of our barns, it is what it is. They might have a door, they might have some ceiling fans, all those types of things. Keeping doors open, obviously, when we are doing our cleaning is going to be helpful. Shavings are preferred over straw as far as picking a low dust option. Cardboard or paper is actually better, but to me, the ammonia smell gets much worse. So you kind of have to pick your battles sometimes. And then also just let the dust settle. So for instance, if you're doing your morning chores, the horses are already outside. Some people will wait to do the chores until they're ready to bring the horses in. Well, that means there's a lot of dust still in the environment. So if you do your morning chores in the morning and the horses don't come in until 5 o'clock in the afternoon, that gives enough time for the dust to have settled again, the stuff that you stirred up. So mucking out their stalls, putting their hay already in for the evening feed, all those types of things are going to reduce that dust exposure in the environment. As far as treatment options are kind of twofold, sometimes threefold, depending on the severity of the horse. But the main two are reducing that airway inflammation using steroids and reducing that bronchoconstriction or bronchospasm with bronchodilators. So we have a couple of different options, inhaled or systemic. Systemic meaning I'm treating the whole horse. Inhaled, I'm treating the lungs only. And then systemic, obviously we have different options, oral or injectable that you give in the muscle. And then similar for reducing bronchospasms, we have our inhaled or our oral options. Of course, I can't not say this. So again, which treatment options is best for your specific horse is dependent on, again, what is the cyclamen of the horse? What is the severity of equine asthma? What is the environment like? How have we been able to manage it best possible? The ability to administer medications. And obviously, does the horse have any concurrent disease, or is he already on some medications for a different problem? And obviously, cost is a big factor. So everything that we look at, you know, not just saying, hey, your horse has equine asthma, here is something that you can do to treat it. No, we're looking at all those things to then make the best choice possible, because we have a lot of options to choose from. So just going over a couple different ones. Inhaled steroids. We have our labeled FDA-approved inhaler for horses, which is called the Azervo Equihaler. We also have a AeroHippus, which basically uses the human puffers as far as giving inhaled treatment. And then we have our nebulizer treatments as well. And this is actually my own horse getting a nebulizer treatment, being a very good boy for once. As far as bronchodilators, again, similar. We have our inhaled options. Again, human puffer, basically. Or we have our oral medication, Ventibulmin, probably somebody has used before. And then, like I said, mucolytic. So if we do have quite a bit of mucus, we can also address that by an inhaled route or an oral route. And the oral route, as most of you probably have heard of before, spudalysin. Inhaled, we're looking at saline, or nebulized, I should say, or acetylcysteine. Then, obviously, the question becomes, well, what else can I give my horse? Well, there are some supplements, obviously, on the market. The only one, I should say, that has actual study behind it and literature to prove that, yes, it does, in fact, help, is this product, Alera. And then there's obviously numerous different products when you go to the feed store, to the tack store. Some horses do well on it, some horses don't. It really depends on where do you want to spend your money, right? Because we don't really want to spend our money to a supplement if that is not actually going to be cost effective versus potentially investing in a hay steamer that you're going to have lifelong, and you're basically not spending your $200 per month on supplements that potentially not going to work, but I'm going to make one big investment in a hay steamer and I'm going to use that forever. So you gotta have to look at it big picture wise as well, not just initial investment sometimes. Follow up, very important. And I like to follow up a lot with my clients, as some of you know. And I ask a lot of questions, hey, how is your horse doing, etc. Because obviously the first thing I wanna know is the horse responding? Because obviously that's the goal, is the horse responding. Some horses do respond better than others, and sometimes they actually respond better to a different treatment option or a different treatment plan. So making sure that we are on the right plan for that specific horse, that specific case, is important. And if we are not seeing much improvement, then a re-examination, potentially a re-BAL is needed, because I can actually see, did I make a difference in the lungs? And if my lungs are pristine, but the horse is still coughing, well, then I want to make sure that I am not missing something, for instance, in the upper airway. That could be a cause of coughing. Some take-home points from my talk is that equine asthma is the most common respiratory disease amongst our equine population. And again, nobody is excluded from this. Early recognition is key, because if we can prevent airway remodeling from happening, we're going to have longevity of our lungs and obviously our horse, because lungs are very important. Management is key, so you want to really hammer on the management, and we really want to only treat when we need to treat. And we kind of keep sometimes some respiratory drugs on hand for an acute crisis, because if the horse goes into that acute crisis like the horse in the video, you want to have something on hand to give right away before you call your vet, because it is rare, but some horses can die from an acute asthma attack, similar as people. Thank you for your attention. Then I want to thank the UCVM pathology group who lent me the 2 specimens. I also have the respiratory treatment option specimen, so everybody can walk by when we go to lunch just to have a look-see, and then I'll take some questions.
All right, any questions?
Can it be seasonal?
Yes, equine asthma can definitely be seasonal. Some horses, again, they get triggered by pollens, for instance, so we're going to see that much more in the spring, summertime. Some horses get actually triggered by cold, by being out on the round bale. Some horses can be triggered by going into specific arenas. So again, is that just the dust that is in that arena, or is that latex, for instance, in the footing? So every horse can be a little bit different as far as when they can flare or when they kind of get triggered by something.
Have you noticed any correlation between specific types of footing in arenas and the severity of the asthma in the horse? Like obviously there are horses that are more susceptible, but in terms of what you've seen, is it like, have you found any specific footing that's been more kind of damaging to those?
So the question is, what kind of footing, or have we seen different types of footing that is just more triggering? And I would say just in general from the literature, the latex type footings. So again, if you also have a footing that is just super dusty, and you know when the horse is trotting around and it already has this big smoke, again, what do you do beforehand? You wet down the arena as much as you can. Some arena footings are specifically kind of low dust, but you still have to kind of wet them down to have that product work, because there are different products to make your footing less dusty, right? But I would say there is literature supporting that horses can have this latex allergy basically in specific footing. So if you have a specific footing at your barn, it would be nice to know, okay, well, what type is this, what brand is this, because it might be just something that is triggering for the horse.
Have you ever found like a high concentration of particles of footing in like BAL samples in comparison to others?
No, so I have not seen any footing particles in BAL samples. We can see sometimes some smoke, we see pollens, dust, you know, all those types of things, but not actual footing particles, or that we can say that this is truly a footing particle.
Is it possible for a blockage, say, more minor, not so serious, to clear up on its own when you reduce some of the triggers, like pollen or dust or mold? Or is it a case of like once blocked, always blocked?
Sorry, repeat the first part.
Have you ever seen like a blockage clear up on its own, say once you reduce the triggers, where the blockage will clear up without, say, steroids or something? Or is it a case of like once blocked, always blocked, unless you treat it?
Yes, so good question. So the question is, can we just change management or environment and therefore, you know, have the horse breathe better, or do we always need to go for treatment? And I would say most of the times, actually, we can make quite a bit of difference with just our management. Again, what is feasible, what is not feasible is per individual barn, person, you know, all that type of stuff. But it takes about 4 to 6 weeks for the lungs to calm down after we have removed the triggers. So let's say the horse triggers super bad on hay. Okay, we remove the hay. 4 to 6 weeks later, without any drugs, the horse should be quote unquote normal. In the back?
As far as management goes, you know, the ones that you're showing the hay net, we're all using hay net these days. As long as there's no hole in the hay net, even with the hay still being as here, even if it's square bales, is that still a good management sense, or do you need to go above that? I just noticed the hay's a lot dustier this year.
Yes, so the question is a hay net kind of covering those round bales or square bales enough? And I would say yes, as long as they don't have those big holes in them. The only issue that I would see is when we have a hay net on a hay bale, the horse is going to spend longer because it takes longer for the horse to eat before they take their break. So again, if they are getting super triggered by hay, just having a hay net around it might not be sufficient. But if we have some milder clinical signs, him preventing from burying his head all in the hay and just having a hay net that actually works should be fine. Yeah.
All right, one more question and then we'll have to move on to the next one.
How
Yeah, so ideally we stick a horse in a bubble. Right? Breathe in sterile air and, you know, be bubble boy basically, but obviously we can't. So when we want to reduce damage and exposure to smoke, we have to think about, well, what can we do? So if it's super smoky outside, but you have place to put them inside, and you have obviously good ventilation, and it's not smoky inside, put them inside for the day, because having them outside, breathe in the smoke all the time, is going to be more detrimental for them to be outside than just being inside for a day and eating some hay. Also, when the smoke index is quite high, so 5 or above, that's kind of when things get triggered. So just knowing what the smoke is going to be for that day, and we obviously don't want to be exercising a lot when they have to breathe in the smoke. So for instance, at the racetrack, when the smoke is quite high, they will actually cancel the races because of animal welfare, because we don't want those horses to be racing in smoke. So even though you have a lesson or you had the day planned, if it's super smoky, think about your horse and say, I think we should just rest today.
Okay, so we can grab Dr. Hannon at lunch and ask her some more questions, but thank you, Jillian.
Thank you.
All right, next up we have Dr. Jordan Cook. And as you can see, she's recovering from a bit of a surgery, and I'm pretty confident that if one of our surgeons did her procedure, that she'd be up and running around, right?
I would agree with that. I would agree with that.
All right, take it away, Jordan.
Dr. Thompson's talk had me feeling quite old today as I'm sitting in the back with my crutches, and as you can see, I'm a little bit propped up. Those of you that know me or know that this is probably the hardest position for me to talk from, because I like to move and talk with my hands, but we'll make do with what we can. So today we're going to talk about equine chiropractic care. To start out, I was an intern at Moore's coming on 14 years ago in 2010. I'm back and I'm an owner now. A large part of my practice is doing chiropractic and acupuncture and what I call integrative medicine. So I do, I'll come out for your dental, I'm there for your lameness exam, but I'm also there doing a lot of chiropractic and acupuncture treatments as sort of like the whole horse approach, and not just looking at it as, okay, yep, this horse has a tendon injury, not just, oh, this horse needs these joint injected or it needs its teeth done. Kind of being able to look at this horse in a bit of a different way, and looking at it more biomechanically instead of just looking at one leg or one problem. So to start out with, what is chiropractic? So chiropractic itself means practice with your hands. That's where the term came from. What is the actual definition of chiropractic? It is the science that concerns itself with the relationship between the structure of what you're working on. And so in our case, a lot of the times what we're talking about is the structure of the spine, and how that relates to function. And so again, we're primarily talking about the nervous system and how that relates with the spine, the spinal cord, and all those nerves that come out and allow the body to function properly. So then my job is looking at how does this relationship affect the restoration and preservation of health, in this case in our horses. So we are using manual or manipulative therapy to treat what are called subluxations. That is in chiropractic research, they use the term subluxation to describe an area that's going to be adjusted. So what does a subluxation mean? It is dysfunction of a segment. So a segment might mean a joint, it might mean a dermatome, it might mean it's just a very specific area. So it's a dysfunction in that area, often due to muscle spasms, adhesions, scar tissue, which I'm dealing with right now. So if only we could just pop that and I'd be good to go. It just unfortunately doesn't work quite that way, and it's a lot slower in human medicine than it is giving the clinic a call. So maybe I might need to call Dr. Madsen. So vertebrae and bones might move improperly, and this impacts neurologic function. It then interferes with information processing in the body, which then causes both neuromuscular as well as visceral organ dysfunction because things aren't talking and things aren't firing properly. So if you went to your human doctor and you said, oh yeah, the chiropractor came out and was treating my horse's subluxations, they would look at you like you have two heads. So in the MD world, in the doctor world, they talk about subluxations as being basically things have blown to pieces. So significant structural displacement or separation of a joint. That's what a subluxation is to your GP, to your orthopedic surgeon. But to your chiropractor, they will completely understand what a subluxation is because they treat them every single day. So looking at the anatomy, the way a horse is set up is obviously very different than we are, but at the end of the day, we have the same spinal structure, just that they're a quadruped versus being a biped. So they have 7 cervical vertebrae, 18 thoracic vertebrae, 6 lumbar vertebrae, 5 sacral vertebrae, and then sort of approximately 18 coccygeal vertebrae, which make up the tail. So it's super important for us to know the actual anatomy of the bones that make up the spine, because those are what my hands are treating. So when I'm out and I'm adjusting and palpating, I'm feeling those vertebrae in order to figure out how those joints are aligned and whether or not they're moving properly. So the joints in the body all move very differently. When we talk about a joint, a lot of the times we are thinking of the distal limb. So we're talking about how a fetlock might bend, or a knee might bend, or a hock might bend. But let's not forget about the axial skeleton and how those joints have to move just as well for your body of the horse to be able to carry its own weight and do all the athletic things that we're asking it to do. So when we talk about the cervical vertebrae, that's our neck. I mean, when we look at our own neck, we all, those of you that have been to a chiropractor, had neck problems, been in a car accident, you know that this tiny little bit of space can cause huge problems. Any of you that have had whiplash, that have had nerve compression, have torticollis, any of those issues with your neck, I mean, look at how small that is. Compared to in a horse, where you've got your vertebrae in your neck that take up 1/3 of the horse's body size. So they can have a lot more problems. They're carrying so much weight. They're carrying that horse's weight when we're riding. When they're grazing, there's so much extension that has to go into that horse depending on the type of riding you do. Your horse could be being asked for a lot of flexion. If we think about some of our collection and dressage methods, we're asking that neck to move a lot. So the pole is sort of the top of the neck where it combines in with the skull. And those first 2 neck vertebrae are very unique. They're called the atlas and the axis. They're what are responsible for our yes and our no. They in how they rotate. So they actually move very differently than the rest of the neck. So then the remaining 5 vertebrae that make up the lower part of the neck are all set up basically carbon copies of each other. A lot of people think that the neck runs right underneath the mane and the top part of the horse, but it doesn't. The vertebrae actually dive down the lower part of the neck and then attach in, and they dive under, you know, kind of by the sternum. So they come in right at the bottom. So you can see, I don't think I have, do I have a laser pointer in here? Oh, no, uh-oh. Uh-oh, there we go. There we go. So the neck, the cervical vertebrae actually dive down, as opposed to the mane would come down and across to connect to the withers like that. Your thoracic vertebrae, those are the ones that make up kind of the upper part of the back, where our saddle would fit and where your rider is going to be. So they have really tall, what are called dorsal spinous processes. So those are these big, tall spines that stick up. So you can see that the actual bodies of the vertebrae run across. I also am not a surgeon, clearly. And so the actual bodies of the vertebrae create a fairly linear line across the back of the horse. But what creates the shape, which then holds up all those muscles and supports our saddle, are these dorsal spinous processes. So the size and the shape of those are going to depend on the breed and conformation of the horse, which is why it can be so frustrating to get your horse's saddle fit and sometimes very, very expensive to do so. Your lumbar vertebrae is the same as our lower back. Horses have very unique lumbar vertebrae. So when we look at the lumbar vertebrae, so this is kind of there we go. So here's our dorsal spinous processes sticking up. You can see here's the back of the rib cage attaching to our thoracic vertebrae, and then on our lumbars they have these very long transverse processes. That is where all of that muscle in that loin and lower back of the horse, they sit on that. And that's what allows so much flexion, and this is why I want to be standing. This allows so much flexion and extension in that horse to be able to do some of these cool things that we ask them to do. So we can ask them to be a reiner, we can ask them to sit down, but then we can ask them to be a jumper and extend over the top of a joint, over the top of a jump, and that's all because of how their lumbar vertebrae are set up. When we compare that to a dog, in a dog, they can not necessarily, yes, they can do flexion and extension, but they get so much lateral movement, as we can see in our agility dogs. If you've ever seen your dog, running around, they have so much more lateral bending because they actually have really, really short transverse processes, and they actually have little accessory processes that allow their vertebrae to lock together so that they can reach this maximum flexion in each direction without hyperbending. They can kind of lock their vertebrae together. So dogs and horses are set up very differently in their lumbar area because their jobs are so different. So everyone always talks about kind of the pelvis and the sacrum, huge area of problems because this is where the spine and all the vertebrae actually attach to the pelvis, which then attaches to the hind legs. So your spine runs through your pelvis, and you have one area called your sacroiliac joint where those are held together. And so you have one joint supporting the entire back end of your horse's body. If you think then of all of the things that we ask your horses to do, all the loading that we ask them to do, if they don't have the proper range of motion in that area, they don't have the proper muscle development in that area, they are unable to do so. And it's not that they're being bad, it's that they physically are unable to do so in the way that you're asking them to. And that can be a pain response, that can be a fitness response. It can cause behaviors like your bucking and your rearing and your just resistance to move forward. It can change your horse's gait so that they often are very stiff and they're not striding up or reaching forward properly because they've kind of had to lock their pelvis in order to prevent it from flexing and extending because it hurts or they're physically unable to do so. So they kind of lock themselves and then they just kind of become little pogo sticks. So, some people will talk about, my horse kind of bunny hops at the canter. He's not very smooth. He doesn't want to stride out and reach forwards. A lot of the times I'm looking in this area to be like, why is it not moving properly? So if any of you have had your horse's SI joint injected, so this is a top view. So this is, again, those vertebral bodies that are coming through in between the giant hole in the pelvis. And then the wings of the pelvis come up. So that's what makes, some people refer to it as the hunter's bump, or the very top of the horse's pelvis. That's actually two separate bones. So that's actually this tuberous sacrale and this tuberous sacrale from the left and the right. And then your spine runs in between that. Where they connect is called your sacroiliac joint, and it's this space under here. So where your sacrum connects to the wings of the bone, so right in here, it's about 8, 10, 12 inches deep depending on how much butt muscle your horse has. So if you have had your horse's sacroiliac joints injected, then, because you can imagine there's all this muscle sitting over top, right? And so we will use an ultrasound to guide the needle all the way down to treat the joint that's actually way down here to make sure that our needle and our medication get into the right place, okay? So the joint is very large and has a very big role in how the horse moves. So then this is how kind of everything is all put together, right? So again, to emphasize, you've got your cervical vertebrae in your neck actually run a lot lower, whereas if you think of the horse, how it's put together, this is my guy, you've got the cervical vertebrae do not run up here, they actually run down here. You've got your withers, right? And then your actual bodies of your vertebrae actually are way down here, and what you're sitting on is dorsal spinous processes of the vertebrae, and then going all the way back to the top of the pelvis here. Some people refer to that as a hunter's bump, which is incorrect terminology, but that area is actually made up of the two bones at the very top of your pelvis. So what is the job of these vertebrae? Why am I harping on this so much? They house the spinal cord. And again, they vary in shape and size based on location. So here is an example of a cervical vertebrae, and then that hole is where your spinal cord is going to run. Very sort of small, compact bone, but holds a ton of muscle. Then you've got your thoracic vertebrae, kind of smaller body, but then huge transverse process where the withers are. And then again, those lumbars. Here's a great view of those giant transverse processes that are going to hold all the muscle. So, promise I'm getting to my point as to why this is important. But you've got your body of your vertebrae, you've got your lamina, which is like the roof surrounding, because your spinal canal is here, that's where your spinal cord runs. The roof of your spinal canal. You've got the walls, which are called the pedicles. The dorsal spinous process up top, those transverse processes at the side, and then we have what's called your facet joint. And so, again, some of you may have heard of having your horse's cervical facets injected or your neck joints injected. Some of you might have even had those done yourself, whether you've had them done in your neck, whether you've had them done in your back. Basically, facet is a fancy word for joint, but very specific to the actual spinal column, because they're at different angles than what we see in the rest of the body. So that, and then we have this weird area called the intervertebral foramen. So big fancy word. We have the spinal cord that runs through the spinal canal. Well then, how do the nerves get from the spinal cord out to the rest of the body? They go through this hole called the intervertebral foramen. Foramen means hole. So it is a hole in the vertebrae that the nerves are able to get out from the spinal cord out to the rest of the body. And what happens is that these facet joints, these mobile areas of the vertebrae where the two of them connect, they sit right on top of, so there's your intervertebral foramen where your nerves are coming out, and then we've got our facets that sit right on top. So this is a lineup of some cervical vertebrae. These are our facet joints, right? So these are the joints where each vertebrae connects to the next. That hole underneath is your intervertebral foramen. So that is where the nerves from your spinal cord leave and they go out and serve the rest of your body. So how does that relate to my job? Well, what happens when all of a sudden that hole gets a little bit smaller? So when we know the facet or the joint in those vertebrae are mobile, right? And just like any other joint in the body, they can get stiff, they can get arthritis, they can get inflamed, just like when we tweak our neck or we tweak our back, we can get muscle spasms in that area. We can, like I said, we can get arthritis development that can narrow that intervertebral foramen. We have all these different things. We can get scar tissue that can build up and then cause that foramen to become narrowed, putting pressure on the spinal nerves as they leave the spinal cord itself. And then all of a sudden we have a change in how those nerves are functioning. And so are they able to do their job as properly? Where are they going? They have motor function in allowing a leg to move or allowing a muscle to contract. And then also sensory in bringing back what my leg is doing in space and bringing that back to the brain. And so if those can't function properly because they're being compressed, then that's going to change a lot of things in how your horse is able to move. If maybe its quads can't fire as well because that femoral nerve isn't able to do its job as well as it can, or if your horse is having some pain from trying to move and so then it's really stiff through its neck, and then again all of those muscles become tight, they become adhesed. Some of you may have felt that on your horse's neck before. They just feel stiff and the muscles don't want to move. They're not fluid and soft. And that can all affect your intervertebral foramen. So we're going to do a chiro exam. And what we're going to do is look at the whole picture of the horse. Many of you will know Dr. Rock, kind of our original, who still putters in and out of the clinic. I think he's officially retired, but I won't say that out loud. So, so an exam on a chiro case is going to vary from case to case. When I get called out for initial chiro, I have no idea what I'm getting myself into in most cases, because I can get called out for anything. Sometimes I show up and the horse is a happy, healthy Spruce Meadows jumper, and they just want to make sure that it just feels as good as it can so that it doesn't knock a rail and that they can get a clear round and get the blue ribbon, right? I can also get the complete opposite end of the spectrum where I've got my 30-year-old geriatric, like we talked about, that lives in the back 40, isn't very active, but the owners are noticing he seems a little bit more stiff, a little bit more sore. So I'm going to go through the same process with every single horse, being able to look and decide what my best treatment plan for this horse is going to be. I have a lot of horses come in that just based on how they walk into my exam room, based on how their muscles look and their posture standing, I can already tell you how that horse is going to move as soon as we take it into the round pen, because you get a lot of patterns in, okay, well, if my SI doesn't move, then I'm going to stand a certain way, and then my hamstrings are going to be tight. So then when I get out there, I'm going to be really stiff. So then I don't want to move. So I'm going to bend and put all my weight on my forehand. And so those horses come in, and I'm like, okay, so I bet you your horse does this and this. Okay, so does he have difficulty doing this? And I mean, a lot of people look at me going, oh my God, how did you know? Your horse told me. Your horse told me based on its posture, based on how he felt when I touched it, when I asked him to move certain things. He told me where he's sore and why he's not moving properly. So I'm going to look at your horse's muscle tone. I'm going to look at how symmetric it is. Is he underdeveloped? Is he overdeveloped in certain areas? What's his posture like? Does he want to stand camped under himself? Does he want to stand stretched out? Does he stand sort of one leg always pointing? Does he always carry his head really low versus carrying his head really, really high? Then I'm going to watch them go. So I'm going to watch them go in hand. I might, depending on the circumstances, watch that horse lunge. And again, depending on what's going on, I might even watch that horse with a rider under it. If we're having really minute performance deficits, or I have a horse that looks great on the lunge line, but is really not able to do its job, then I might put a rider up and say, okay, what changes? How does your horse change how it's moving? So that's kind of a lameness exam, but Cairo exam at the same time, but it really tells me a lot about what I'm getting into. I'm very lucky in that I'm also a veterinarian as well, right? So I put my vet hat back on. If this is a new patient that I haven't seen before, or even if it's a regular patient of mine, if we have a new lameness that's going on, I'm going to take a step back, right? And so depending on how severe that lameness is, I might be like, hey, you know what? This horse is pretty lame today. He's not the best candidate to do some chiropractic on until we know a little bit more about why this horse is lame. So I might send you back to your regular veterinarian. We might, if you're a regular client of mine, I might do a regular workup that day and say, hey, chiro hat off, we're going to put that to the side for now. We might still bring it in, but we still need to get to the bottom of why your horse is showing a lameness today, because maybe your horse is stiff through its back because it has an abscess or it needs a tox injected. You know, they all kind of go hand in hand. And so we want to make sure that your horse is feeling as good as it can. That's not to say that, so that's kind of talking about acute or new lamenesses. I have a lot of horses that are what we call kind of chronically lame or serviceably sound. My own guy, he was serviceably sound for many, many years. And he got regularly adjusted because it helped extend the time in between his injections. It helped make the rest of his body feel really good so that that little bit of a soreness that he had wasn't such a big deal because he was compensating for it, so we made the rest of his body feel good. However, disclaimer to that, I do have some patients that maybe they just look a little bit stiff or they just look a little bit off. Then we adjust them and we undo all those compensatory measures that have been holding them together. And within a few days, those horses, you're like, wow, we thought they were only a little bit off on that left hind. Now they're really off on that left hind. Again, most of the time, I kind of get an inkling for which horses those might be, and so I can warn my clients. And I warn my clients on every patient that I adjust. 99% of these guys are going to feel like $1 million the next day. They're going to run around, they're going to kick up their heels, you're going to be like, you made my horse young again. We get the odd horse that's a bit sore the next day. And so, you know, getting that feedback on how were they the next day. I don't like to adjust a new horse for the first time right before a show or right before a jackpot because I don't know how they're going to react the next day. Again, 99% of them are going to feel amazing, but I have a couple patients I can think of off the top of my head that we know that they're going to feel like garbage the next day. And they're going to be tired, they're going to feel achy. I know myself when I get adjusted, I feel really achy that night. Like it's not like I walk out of there feeling like $1 million. I walk out there and that night I'm tired, I'm stiff, I'm sore. By the next day I feel really good, but I need myself an adjustment period. And sometimes so do these horses. And so that is something that I have used before when I have these mild, subtle lamenesses, that we have back soreness, we have neck soreness, we have other things going on. Okay, let's adjust them and see what happens. And hopefully that clears it all up, but we know there's something else lingering there that it might come to light once we undo all that locked up behavior that they're showing us. So I'm going to motion palpate. I'm going to get up there and I'm going to move each individual vertebrae and decide, is this moving normally, is this not moving normally? So I can, again, I'm identifying those subluxations, dysfunction, abnormal or reduced range of motion. You'll hear people use the term stuck. Don't like the term stuck. But it might be that, so dorsal spinous process, transverse processes, I'm a vertebrae. I can be restricted in that I don't want to move to the left. Or maybe I only want to move to the left, but I don't want to move to the right. That people will refer to that as being stuck. I don't like that term because that's not actually what's happening. But you know, we're going to have changes in range of motion because my vertebrae should be able to do this. They should be able to do this. They should be able to do this. And so how is it that vertebrae isn't moving anymore? And then these areas of dysfunction, like we talked about, can impact that intervertebral foramen and then cause areas of problems. So it helps me determine where I'm going to adjust. The actual adjustment itself is not pushing the bone back into place, okay? We are doing what's called a low amplitude or low distance. I'm not doing this, I'm doing that. I'm moving this much, but high speed. And I'm doing it in a very specific location over the facet joints, or and then I'm doing it in a very specific direction, depending on the angle at which those joints are at. And so, yes, my broad goal is to improve range of motion and function. But what am I doing? I'm actually gapping that joint a little bit. So I'm causing those facets to actually just move just a little bit, okay? Because maybe they, again, term restricted like this, and they don't want to move because of adhesions, because of inflammation, because of scar tissue, because of some arthritis. So they don't want to move, and they've said, nope, this is where I'm going to stay. So then that's going to impact how those joints can flex and bend. So all I'm doing is just gapping them just a little bit to help break down adhesions, to help stimulate what's called a reflex arc. So as we stretch something, we cause relaxation. Your body's response is when something is stretched, is we have to relax it so it doesn't tear. So we stretch all those receptors, so then they relax all those muscle spasms around it so that they don't tear. We're decreasing pain. Nociceptors or pain receptors in that area are being impacted, so we're decreasing pain. We're stimulating the autonomic nervous system. A lot of time we'll see horses breathe a little heavier. They might sweat a little bit. They might blow or yawn or lick because we're stimulating their entire body by one adjustment. We're also stimulating the brain. This is really important, and there's some really interesting research on Alzheimer's patients and people on adjustment. We talk about you move it, you know, you don't move it, you lose it. It's very similar. They're seeing a lot in dementia patients where keeping the body active stimulates the brain and therefore can keep you mentally functioning for longer. Same goes in theory, would be the same in the horses, right? So if we're stimulating the brain, we can decrease pain and turn things back on that maybe those muscles haven't. And so we get proper nerve signaling and transmission, and helps restore those normal biomechanics. Like I talked about, we need a more balanced gait so that they can use themselves properly, and then engage those muscles to rebuild. This is just a neurologist taught us in our chiropractic course. This is all of the things that it stimulates. So I had to memorize this. So a lot of times I'll give you guys some homework. So this is a great book, Activate Your Horse's Core. Has a lot of great exercises to help maintain that muscle. Dr. Thompson briefly touched on it, but some great tools in our toolbox are going to be the EquiCore system, as well as like a Pessoa system or the Greenhawk knockoff, in order to get that horse engaging its hindquarters, engaging its core, and rebuilding some muscle and some top line. So I use these appropriately in my rehab. You know, in my world, any horse is a candidate for chiropractic work. Like I talked about, a lot of those lack of drive, back pain, they don't want to bend, we're having some performance issues, you know, just doesn't seem right, kind of a weird lameness that's not really blocking out. Those lovely geriatrics are some of my favorite to adjust. I do have to adjust how I treat them though. They can't handle a lot of stimulation in a lot of situations because they're hot messes. And so a lot of times they maybe get smaller adjustments over a period of time instead of sort of a big one. Recovering from surgery, I'm currently getting adjusted and acupunctured every 3 days because I'm a hot mess after my surgery. Organ dysfunction, again, increase that duration between joint injections by keeping the whole body feeling as good as it can. Even some of my other patients are, this is my baby. I adjusted him every day for the first like couple weeks of his life, right? Where birthing process is not kind, and they come out and they have restrictions. So I have a couple breeding farms that when I'm there doing their snap test, we adjust the babies just to make sure that everything is feeling as good as it can after coming out. This was a patient of mine when I was working back in Ontario. They had noticed he was a little quiet, not moving well, so anything can be adjusted. And I will reiterate that if your horse is lame, best thing is vet hat first, then we bring in chiro after we make sure that they are okay, because we need an accurate diagnosis. We need that team approach of working with your vet, your farrier, your massage therapist, your chiropractor, your acupuncture, so that we can set your horse up for success and have the best response to treatment and good expectations for what we're going to get out of it. So, because unfortunately, I can't fix this with chiropractic. I have seen every single one of these when I've been called out for chiropractic adjustment. So, like I said, I have seen it all. I never know what I'm getting into, but I can't fix any of these, unfortunately, with an adjustment. So, any questions? This is my guy. What do you look like on the track? And then packing out in the mountains.
All right, we'll just do a couple questions because then we have lunch all ready to roll. So, 2 questions.
That hand was up first.
Can a horse have chiro after kissing spine surgery?
Yes. Yeah. With kissing spine, the question was, can a horse have chiropractic work after kissing spine surgery? So in kissing spine surgery, we're cutting the ligaments in between those dorsal spinous processes. So once the incision is healed and once that has happened, I'm not adjusting those dorsal spinous processes. Remember, I'm adjusting the facets. So once that horse has been cleared by the surgeon, then yes, for sure. And then a lot of times I'll come in, I'll do some acupuncture, chiropractic work, and help build a rehab plan afterwards. Yeah. Right at the front.
If you're considering buying a horse, do you think it's a good idea to x-ray the neck and have a chiro exam?
So that is a very loaded question. So right now, kissing spines is the hot topic, right? And so right now, everybody wants their horse's back x-rayed. I have a lot of horses that have terrible neck x-rays, terrible back x-rays. Those horses are still competing at Calgary Stampede. Those horses are still competing at Spruce Meadows. My own horse, randomly, when I x-rayed his neck for fun, he had some fracture fragments. So obviously he had, maybe slipped in the field and crashed and banged. We can find things on x-ray, but you have to, pre-purchases are a whole other kind of discussion, but just because we see stuff on x-ray does not mean they're a problem, they're a clinical problem, but just because x-rays are normal does not mean that horse clinically does not have back pain or neck pain, okay? So you have to use them hand in hand. So it's not just the x-rays, it's the x-rays combined with palpation, combined with range of motion, combined with how that horse is traveling. That's gonna tell me the picture on whether or not, but again, I can have completely normal x-rays. I've had completely normal x-rays, completely normal bone scans, but that horse still responded to treatment of the neck, right? So you have to keep those in mind, that pain can be there even if we can't see it. Okay.
All right, thank you, Dr. Cook. All right, everyone, we're going to get rolling again with our afternoon session. A little change in plans just to keep on track. We'll do the door prizes at the end after the platinum talk. So what we have for you now is another set of interns. So I have Agath and Camille, and these are 2 of our international interns. And that's one of the things that we're really lucky in our practice. We get a lot of international students coming through, and then a lot of them come back as interns for their intern years. So we have a really diverse group, and they bring a lot of different experiences and different education with them as well. So Camille and Agath are going to talk about some first aid and kind of what's an emergency, what's not an emergency, and I hope they have some nice gory pictures for you. All right, take it away, ladies.
Hello, everyone. It's really nice to see you all here. So I'm again, this is Camille. We're both from France, actually, and we're just going to chat about a few emergencies and what you can do at home and everything that can help making things better and work smoothly during emergencies. So the first thing to do in emergency is recognize that there is something happening. So usually you guys know your horses better than everyone, so it's probably something that you have already under control and that you know something is wrong. It's more about recognizing that something is wrong with the horse and then trying to go deeper with what is actually happening. And then there are a few signs that you can probably know more than others, like colic signs or attitude or all these kind of things. But sometimes horses like to show us things a little differently. It can get a little trickier. So this is the part where you guys really have an important role in recognizing that something is wrong. And also you have a huge role in recognizing it like sooner, because the sooner you're going to recognize there's a problem, the sooner we can act on it, and then it just helps for the prognosis and how we handle things what we're doing as veterinarians. So a few lists of the things that can happen. So we do have different kind of emergencies. We have emergencies in which time plays a really big role in the outcome and what's going to happen with the horse. These emergencies usually include colic, dystocias, hemorrhage, chokes, respiratory obstructions when the horse can't breathe anymore. The falls are really emergency when it happens, and also acute non-weight-bearing lamenesses. So there are a few of them that are pretty obvious, like colics and dystocias, where we know that time really plays an important role in how things are going to get going. But it's important to know that in some milder emergencies, like chokes or lamenesses, time can actually play also an important role on the prognosis and the outcome, because the sooner we get to them, the better it is and the better chance we can give them. And then there are other kinds of emergencies which are also emergencies but don't really affect the vital prognosis of the horse, but still have to be seen by a veterinarian, because the more you're going to wait and try and treat it yourself at home, the less it's going to help us to have a good outcome in the end. So these usually include eye problems, wounds and lacerations, diarrhea, fever. So fever usually will show up as a horse that is depressed. So it's kind of the first symptom that you're going to see is that your horse looks kind of sad. So it can look like it's not something really wrong happening, and then they can just have a bad moment. But if it's something like colitis or any like major issues that starts with a fever, the sooner we get to it, the better prognosis we'll have with it. And then it's the same with retained placentas. So the first thing to do is obviously to call the emergency line. I hope you guys all have the number on your phone so you don't have to look for it for hours in case of emergencies. So if you don't, just take some notes, it's right there. And then, so you'll have the answering service on the phone, and then the veterinarian on call will call you back and then have a chat with you about everything that you found, the symptoms that you've seen, and the instructions to go from there. So what we would recommend is for you guys not to administer any medications before that, because sometimes it can just not help with what we do later in the end. And then another thing that can sound stupid but is actually not is to put your horse in a safe and dry place and try to clean it, just so when the veterinarian comes to your place or when the horse comes in clinic, we just don't waste time on cleaning the horse to do the actual diagnosis and find what's wrong with your horse. So in the meantime, while you're waiting, there's a few things that you can think about that is probably questions that we're going to ask you guys. And the sooner you start thinking about them, the easier then it just gets to get rolling once we're here to look at the horse. So these things include when the symptoms happen, for how long it's been going, the clinical signs that you guys have seen. So even if it's like little details, it can sometimes really help with the history. And a good history is most of the part of what makes a diagnosis in the end. So it's really important for us to know all details and everything that happened. It just helps us make a better diagnosis. If the horse had previous episodes of the same thing, are the other horses in the farm affected? In some cases, it's important for us to know about vaccines and dewormers, especially in case of wounds and laceration, tetanus, or in fever, lethargy, to make sure we can exclude some kind of like contagious diseases. If the horse is on any current medications, some horses can be on medications that we forget about, like Previcox, Presen, Bute, or whatever. It actually makes a huge difference for us to know that. So it's important just to tell us that when you come or when we come and look at your horse. And then we also like to know if there was any recent changes or events like changing of barn, of the herd, or anything that could help us with that. In brood mares, the pregnancy dates, obviously, and also really important to know about your insurance, what you're covered for or not. In case the decision has to be taken for surgery and all that, it's just easier at nighttime to know what is included in your insurance and what we can do or not. So I'm just going to talk about a few things that we see most of the time that are the main emergencies that we get. So the principal one would probably be colic. As we all know, horses are very poorly designed and they do like to colic a lot. So the first thing to look for are the attitude, the manure output, making sure they're pissing normal manure in a normal amount, changes in appetite loss, and then if you are comfortable, you can always check their heart and respiratory rate, which can give us some kind of indications on how bad it is. You can also take their rectal temperature and look at their mucous membranes. And all of this information can help us have an idea of what colic it is, or how bad it is, or how fast we need to act with this. So the first thing to do when your horse is colicking would be to remove any kind of feed material or put a muzzle on them, because letting them eat can just make things worse. And then the second thing is you can start exercising them, so either walking or lunging in a reasonable amount, obviously. And then put the horse in a dry, safe, and clean area if they want to roll. If the horse is laid down quietly, you can probably let them lay down quiet. That's not a problem. But if the horses start being dangerous or start rolling around or anything, the most important thing, obviously, is your safety. So just be conscious that horses, when they're in pain, can be very dangerous animals. Just be always conscious of where you are in the stall and just don't get in danger. If you feel that they keep rolling and you can walk them, that's perfect. If you can, just don't get yourself into a position of danger. And then, depending on what the veterinarian tells you on the phone, we can probably do more things or not, but this is really depending on the case. Then about the bleeding. So horses have a lot of blood. Horses are big creatures. They have a lot of blood. They can bleed. They can bleed until 8 to 10 liters. We're not preoccupied. And then from like this amount of blood, we start to need to act. So if you see a little blood, don't worry, don't panic. Horses can bleed. The main thing in hemorrhages is about not panicking. So if they have a bleeding because of a wound or a laceration, just put pressure on it. Same thing with humans, just try and stop the bleeding by putting pressure. So in this case, you can do a pressure bandage, and then if the blood keeps going through the layers, you just can keep adding layers. Even if it's 10 layers, just keep adding layers until it stops bleeding. And if you ever happen to have a nosebleed, another thing to do would be to tie the horse up. But same thing, don't get in danger, especially with a nosebleed. If the horse starts really to act dangerous, just don't get in danger, don't get in stall. In case they would lose too much blood. The main thing is always your safety more than anything else. About eye injuries. So eye injuries are equine emergencies. We do have to act fast on them just to get a better prognosis, because the more we wait, the worse it's going to get. They usually don't solve them themselves, so it's really an emergency that needs a bit attention. So you can look for a few things. You can look for the squinting of the eye, for the tear production. You can look at their eyes, see if it's cloudy, if you can see some kind of like cloudiness or like an ulcer. Sometimes you can see it too without doing anything. And then the swelling around the eyelids, any kind of trauma, and all of that can help us. Do not administer any medications in the eyes, because it can just make things worse. So just call your veterinarian. You can always also send a picture and then have someone look at it as soon as possible, because eyes can sound stupid, but they're not, and they are an equine emergency. About chokes. So choke is not what we think it is in human. It's not actually food going in the windpipe. It's just a bolus of food that is stuck in the esophagus. So the signs usually include horses that would have feed material coming from their nose. So it is one of the most common emergencies, and it can become an emergency in the way that horses can get pretty terrible complications from it. So it is something that requires a veterinarian attention. And then the thing that you can do while you wait for the vet to come to the farm or hauling clinic is to keep the horse off feed and to walk them. Sometimes it will resolve, sometimes it won't, but it is something that does require veterinarian attention. Then about the stochas, for those of you that like breeding and have mares and babies at home, it is really important for you before getting in all that process to know what are the stages of the mare delivery, because it really plays an important role to know when something is going wrong, because the faster we can act, the better prognosis for the foal and for the mare. So it really is important if you guys try and breed you mares to make sure that you have all of this in mind and that you know what to expect and what is normal and what is not. Time really matters in this kind of situations for which we really have to act fast. So if you see that there is a problem, just call immediately. And then there are some lines. So this is the AAP guidelines that I have the website at the end of the diaporama if you want to see them. They're actually quite nice and they explain everything. And then you also have the foaling kit essentials, so you can gather a few things just to help with the vet that when we come to the farm or where you're here in clinic, just try and act as fast as possible and have everything ready for the foal. And then about the babies, so foals are not tiny horses. They're really different. They love to diet too. They do have that in common. So there are a few things that you can look for. So their attitude, the way they eat. A foal is supposed to eat. It's supposed to drink. If it's not, it is an emergency. Horses can get dehydrated really fast. And so the same thing as with the delivery, there are a few rules to know about foals. So it's a 1, 2, 3 rule. You can also check that on the internet, but basically this is really important just to make sure that the immunity is passed on to the foal. And if it's not, it is an emergency and the foal needs to be seen by a vet. In general, we do recommend that all the foals are checked by a veterinarian in their first 12 to 24 hours, so we can run an AGG and making sure they have the correct immunity and that we don't risk anything. The dummy foals, here there's a lot of hypothyroidism, so it's also nice if you want to get some x-rays on your foals, as you can see in this picture here. A lot of them would lack bones, and then we just have to make decisions from there. But it is something that you're probably going to require if we see that a foal has any kind of problem, we'll start there and then go and see what we want to do for this. But yeah, foals do have a lot of problems as the one that are written down this slide. And they really are tiny creatures that need immediate attention from a vet because they do like to die very fast. And then I'll just let Camille talk about wound management and lacerations from now on. Thank you.
Okay, so when talking about wounds, the first thing that's important is just check your horse in general. Does it look painful? Does it have any fever? If you can take the pulse, does it have an elevated pulse? Then is it lame? Is it an acute severe lameness? And then you're gonna want to look at the wounds. So how old is the wound? When did that happen? Where is it localized? How big it is? Is it deep? And then is there any swelling or discharge that could indicate some infection? Is it bleeding? How much is it bleeding? And so that's important to remember that if you have a foreign body, please don't try to take it out if possible, because that could cause more damage or bleeding. So take a picture for us, take some notes, and let us know how it looks. So your horse has a wound, what should you do? First, try to move your horse to a clean and safe environment if possible. So if it's outside in a pasture, take it inside in a stall. Then you can wash
the wounds better only with water or just some diluted betadine. Please try not to put anything on the wound before you talk to us. So do not let the wound get dirty. You want to keep it clean, so apply a bandage on it, take a picture, send it to us, and yeah, we will let you know what to do before we come. Mostly the question is it an emergency? Do I need to go to the vet, or is it fine? So what concerns us is if it's a deep wound, if it's a puncture wound, so that's badly located over a joint or an important vital structure. Is there any excessive bleeding? So we talked about it with Agatha earlier. Your horse has a lot of blood, so don't panic if you see just a little bit of blood. You're just going to want to apply more pressure, more bandage. Is there a foreign body? If there is one, that's an emergency, of course, and you should call us. Is there any acute and severe lameness? Is the horse putting weight on the foot or not? Is it swollen? Is there a lot of swelling and discharge? So in those cases, you will want to call us. And it could be fine if you have just a little bit of hair loss, if there is no skin flap, if there is no lameness, just minimal swelling. In those cases, you can just clean the wound with some water or diluted betadine. Same thing, keep it clean, apply a bandage, monitor over the next day. And if it gets worse, if there is more swelling or lameness that developed, then you can call us. Let's focus on puncture wounds. So it's important to know that even if it's a small wound, if it's located over a joint or the synovial structure like bursate or tendon sheets, this can cause infection, and this is an emergency. So in those cases, we recommend further diagnostic at the clinic. So call us, and same thing, clean the wound and put a bandage on it, don't let it get dirty. On the picture you can see, so when we talk about synovial structure, we worry mostly, for example, about the distal limb, where you have like joints, tendon sheets, bursate that can be involved. Here, the hock region is as well critical, for example, and here you can see there is a very tiny puncture wound here, and in those cases, you should call us, and we will make more diagnostic. Okay, so that's just a case to show you how it can look like. So the horse had a heel boob laceration. In those cases, we worry about the coffin joint, the tendon sheet there, and so of course, then you should call us for those type of wounds. What we did at the clinic, we cleaned it, we took some radiograph to make sure there was no fracture, we closed it, and then we did some sample analysis to make sure there was no infection in the joint or in the tendon sheet. We applied a foot cast for 4 weeks, and then we removed the cast, and that's how it looked like 1.5 months later. The horse is now back to work, and it's healing very well. So just to show you that even if it looked like that, your horse can be fine. Then that was the case with the hock wound. In those cases, we worry as well about the synovial structure. So the horse came to the clinic. Again, we did some cleaning, radiograph to make sure no fracture. Then we took a sample of the tarsocrural joint there to make sure that there was no infection. In those cases, we couldn't close the wound, but that's how it looked 10 days later, so it was healing well. Months later, you can see here some forward flesh, so that's a complication. One of the complications that can happen after having a wound, so that's excessive granulation tissue, and in those cases you want to debride it, so to take it off to allow the wound to heal. And so that was about 4 months ago, and the horse is now fine as well, back to work, and is healing well. So let's talk about bandaging. So those are material that you can have at your place, just in case you have a wound. So first, you want to apply some gauze over the wound, and you can help it to hold with some white cling. The white cling, you don't want to put it too tight, just put it on the leg so that the gauze doesn't fall down. Then you want to apply a white cotton and a brown cling. The brown cling, you can apply it very tight. Actually, you cannot go too tight with this one, so don't be scared because you have the white cotton just under it. And then you want to apply a vet wrap, the purple one there. You can go very tight as well with this one. And then the last layer is the light blast. With this one, please don't go too tight because it goes directly over the skin. So you just apply it to make sure it doesn't slip or there is no debris going into the bandage. And then, as we talked about it earlier with Agathe, if there is bleeding, if there is strike through, just apply more layers, more pressure. Okay, now let's talk about acute lameness. So first, important, if your horse is non-weight bearing, it's acute, it's an emergency, so you should call us as soon as possible. The most common cause of those lamenesses are first and hoof abscess, then fracture are common too, infected joint, cellulitis, which is characterized by a swollen leg, which mostly happen in distal limb, laminitis, tendon injury, nerve damage, and nail in the foot. We're going to talk about that. So nail in the foot, that's an emergency. It's a foreign body, so same rule, please try not to remove it. It's important, it's going to help us if you can take some notes, take a picture, just that we have an idea of where it was, because this would give us information of what structure could be involved. So you can place a bandage on it, so to avoid any infection, and call us and we will make some X-ray and further diagnostic. Laminitis, that's an extremely painful condition caused by inflammation in the hoof. And in those cases, the coffin bone goes away from the hoof wall. Its clinical signs are heat in the hoof, increased digital pulse. The horses are like walking on eggshells. They are reluctant to move. They are laying down a lot. That's an emergency, and you should, of course, call us. And as we talked about it earlier too, the earliest you call us, the better the prognosis in the end. And if you have any doubts, then just call your veterinarian. Thank you for your attention.
For those of you who are interested, this is the AEP website in which there are a lot of little guidelines about a few things. So if you're interested in having a look, they do have a lot of several kind of things that could be interesting for the horse owners on what to do, what to think, and how to react in case of emergencies.
Okay, any questions?
You want to apply it and always go caudally, so to the back of the horse. Always to the back? Yes, to the back. Yeah, always to the back.
To the back and then inside, like underneath. Wow, I guess you ladies did such a good job. All right, thank you.
Okay, sounds good. Thank you so much. Okay, well, thank you guys for having me. Can everyone, okay?
Yeah, we can hear you great.
Okay, perfect. Well, thank you for having me on. I hope you guys are having a good day. I kind of chose this topic. I hope it's not too late. I looked up the temperature there, and it looks like you guys are already kind of in the swing of winter. So I thought it might just be a good opportunity to talk a little bit about feeding horses through the wintertime and kind of some considerations to make. Just to get started, my name is Madeline. I am a veterinary advisor for Platinum Performance. So I've worked for Platinum for a little over 5 years now. And I live in Kansas, and today is actually our first snow day, so our first big snow, which is exciting for us. I'm sure you guys are less eager to have the snow and maybe already have a lot of snow up there, but I think, you know, around this time, it's nice to start kind of thinking about what are we doing with our horses for the winter? Are there anything that we should kind of be considering, or, you know, just what are those kind of topics that we should be focusing on to make sure that we're set moving into the winter months? So I can hear you guys. So if you have any questions, feel free to stop me during the presentation. We can talk about anything, or we can wait until the end and have a few questions as well. So I don't know how familiar this group is with Platinum Performance as a company, but I just kind of wanted to start out by kind of introducing our background a little bit. So Platinum Performance was built out of a veterinary hospital as well. And Dr. Herthel, who founded the company, was a surgeon, and his whole plan was to create a feeding program for horses that was more similar to if they could have a natural grazing diet. So one of the issues that he saw being in California was they don't have a lot of grass there, not a lot of fresh green grass at least. And the issue is, you know, the horses would come into the hospital, they would do all of these different procedures, things like that, to try to make these horses, you know, be top athletes or be as healthy as they could be, live these long lives. And we'd put the horses in the stalls, we'd feed them, you know, grain, whatever it is that they had. And back then, I think in the 80s, early 90s, a lot of that was kind of livestock grade feeds, oats, corn, things like that. And Dr. Herthel just thought there has to be a better way to feed these horses, to get them kind of back to if they could be out grazing all the time. What do horses actually need to be eating to help them be as healthy as possible? So when we think about a natural diet in horses, we think about horses being grazing animals, so roaming around, having a lot of different sources of different nutrients, so different grasses, but also different shrubs, flowers, herbs, picking different things kind of as they needed, and also different mineral sources, so different ground, different water, things like that. So they would have a really large variety in their diet, and they would move, you know, over time to find where they could get that fresh green grass and where they could find certain nutrients like that. So I think it's interesting to think about, you know, horses when they were prey animals, when they were roaming around. Typically a horse on its own, to its own devices, would graze for about 16 hours a day, which when we think about the way that a lot of people are kind of forced into feeding their horses now, like I think about my horses in stalls during the day, you know, we don't have access for them to be out 16 hours a day grazing. And so what are kind of those side effects for the way that we kind of have more modern feeding practices for horses? Another thing when we think about horses grazing a lot is the way that horses are physically built. So when you think about the digestive system of a horse, you have the foregut, which is the stomach, the mouth, the esophagus, all of that horses bring in, and that's relatively small. So for being such a big animal, the horse's stomach actually only holds about 8 to 15 liters of volume. So it's pretty small comparatively. Versus the hindgut, which is the whole end, so the large intestine, everything back there, which holds about 90 to 135 liters. So you have a relatively small foregut and then this big hindgut. And the idea with horses being grazing animals and being able to graze for 16 hours a day is that they would have kind of these constant small meals, and they would have their hindgut fermenting those forages, being able to break down those fibers from those long stems that they were eating and turn those fibers into things that they could use, like volatile fatty acids that they use for energy, but also different nutrients like B vitamins, certain amino acids, things like that. So basically, the way that horses' bodies are designed, or their digestive systems are designed, is to have a small stomach. So they're supposed to get small meals all throughout the day that pass along to their large intestine or their hindgut. And then in the hindgut, they're able to ferment those nutrients to give them energy and some of the nutrients that they need. So in an ideal world, horses could be out grazing for 16 hours a day, and this is kind of how things would go. As opposed to a more modern diet where we have our horses in stalls, or maybe it's wintertime, so they don't have access to fresh green grass, or they have to be in, or we're traveling with them or showing with them, or, you know, hopefully not, but maybe they're in the hospital, or they're not allowed to be out for some reason. So what we see in the more modern diet is horses are in more, they're not out on pasture as much, or even if they are out on pasture, they're very limited as far as the types of nutrients they're getting or their ability to graze on fresh green nutrients year round. The other thing that we see a lot in the more modern type diet is larger meals, lesser times throughout the day. So, feeding your horses once or twice a day, feeding large amounts of concentrates. And unfortunately, we know that this type of diet, as we move away from the natural grazing diet and move more towards this modern diet, that has some negative side effects as well. So some of the things that we typically see as we start to move towards more concentrates and less time grazing are higher levels of inflammation. And I know inflammation is something that people talk a lot about, and I think in the human world as well. But what is the concern with inflammation? So many chronic diseases that we're dealing with and our horses are dealing with are inflammatory conditions. So a good example would be arthritis in horses. So arthritis is the number one reason that horses retire from work, and that's an inflammatory condition. So having these higher levels of inflammation, partially from the way that we're maybe feeding our horses, can lead to a lot of these issues being worse, or, just we need to be aware of the way that we're feeding our horses to help control some of these secondary side effects. Some of the other things that we see kind of along the same lines of inflammation are more allergies, more soreness and fatigue, slower recovery time. We also know that as we increase the amount of grains that we feed horses, or increase the amount of concentrates that we feed horses, the higher the risk of colic is. Just because of what we were talking about, the way horses' systems are built, they're not meant to have a high amount of concentrates in their stomach. They're really meant to have those long stems that they break down over time, kind of a slower release energy source for our horses throughout the day. So what can we do as far as, moving our horses away from this more modern diet back to a natural diet? So one thing that we talk a lot about at Platinum is fatty acids. And the reason that we talk a lot about fatty acids is because horses need a certain amount of fatty acids in their diet. They do get them from their forage sources, but the types of fatty acids that they're getting from different sources vary greatly. So when we think about a natural grazing diet, like we were talking about, if horses were out on fresh green grass all the time, the fatty acid ratio that we would typically expect to see in that natural grazing diet would be about 5 omega-3 fatty acids to 1 omega-6 fatty acid. So just to back up for 1 second, say, okay, why are we talking about omega-6s and omega-3s, different omegas? Omega-3 fatty acids and omega-6 fatty acids are both essential fatty acids for horses, meaning that they can't make them enough in their own body. They need to get them from their diet. And they're both essential. Omega-3 fatty acids typically support healthy levels of inflammation in horses, while omega-6 fatty acids typically support higher levels of inflammation. Both are needed. If you can imagine, if a horse cut his leg or if he has a fever, something like that, you need those omega-6 fatty acids to be able to respond, have an inflammatory response, initiate the healing. But for the most part, we rely on omega-3 fatty acids to maintain healthy levels of inflammation. So if horses are out on fresh green grass grazing, the ratio that we typically see is about 5 of the omega-3s, so 5 of the regular healthy levels of inflammation to 1 of the omega-6s. As opposed to the typical modern diet where we have a lot more grains, a lot more concentrates, a lot more seed heads, where we flip that ratio. And you can see here we have about 30 of the omega-6s to just 1 of the omega-3s. So if you think back to this slide and we're talking about the modern diet, and one of the concerns we have is this higher level of inflammation, this is partially why we're seeing that. You can see here how the different ratios of omega-3s to omega-6s are completely switched to have a much, much higher amount in the modern diet. And as we already talked about, inflammatory diseases are very common in our horses, not just arthritis, but also allergies, any of the itises that come to mind, metabolic syndrome, a lot of things that, people see all the time in their horses. So unfortunately, a lot of those diseases and a lot of the things that we're working with in our horses, we don't have a lot of control over, like age, stress, different things that we're doing, showing our horses. But one of the components that we do have some control over is what we're feeding horses, the diet that we're putting on our horses on, and helping to support them to have lower overall inflammation and move them back to the more natural style of diet where they have more of these omega-3 fatty acids available to them than the omega-6s. This is kind of another chart looking at the same thing. So again, talking about omega-3 fatty acids to omega-6 fatty acid ratios and different things that we commonly feed horses. So you can see in fresh green grass, we have about 5 of the omega-3s to 1 of the omega-6s, and then it kind of goes up from there. So if you guys see way over here on the right, you can see corn has about 55 of the omega-6s to 1 of the omega-3s. So it's a very pro-inflammatory feed. And not to say that any of these food substances are bad or not good. They're good for energy and for calories and for different things like that. But when we're thinking about inflammation and getting our horses back to a more natural style of diet, lower levels of inflammation, less responses, we want to start thinking of ways that we could feed our horses more appropriately to move away from such high levels of inflammation. Okay, so let's talk about hay for a minute. I think, you know, when we're going into winter, I just had my hay delivered a couple weeks ago here in the barn, and hay is an amazing place to start. In fact, when Dr. Herthel started working through, okay, well, what do we want to feed our horses? How do we get our horses back to a more modern diet? He really thought we're going to have to start with a good forage source. That's the way horses are meant to utilize hay and grass and things like that into their hindgut, utilize those for different things like energy, those different things we were talking about that they're able to produce in their hindgut. But is it enough? If we just feed our horses hay, are they getting everything that they need, or can they synthesize everything that they need just from hay? Okay, so looking at hay needs in general for horses throughout the winter. So winter or not, generally throughout the year, we say that horses need about 1.5 to 2% of their body weight in pounds per day of forage. So for a 1,000-pound horse, that would be around 15 to 20 pounds per day. Now, I will say, I don't know if any of you guys have a scale of any sort to weigh your hay, but I'm always surprised when I get my hay in. You know, a flake of hay that you have can vary so much from bale to bale. So I do really recommend, if you have a way to measure out what you think, you know, 10 pounds of hay looks like, can be really helpful, because sometimes it does vary quite a bit. And if you're trying to maintain your horse through the winter, it can be helpful to have a more accurate look at how much does this hay weigh and how much should I be feeding my horse. So, of course, this is going to vary based on a lot of different things. So horses that have higher caloric needs, like horses that you're working a lot or training a lot, brood mares, horses that are hard keepers, those horses are going to be more on the higher end of the amount of hay that you want to feed them, as opposed to maybe your ponies or your easy keepers or metabolic type horses, where we'll want to keep on the lower end around 1.5%. You know, talk to your veterinarian about it. In general, we don't want to go much below 1.5% for horses, because they need that long stem forage for their physical benefit and also to get nutrients from. So as a general rule, we say about 1.5 to 2% of their body weight in pounds per day of forage or hay. And then when we look at winter specifically, we know that cold weather and going through the stresses of winter can often add the amount of caloric needs that horses have. So kind of a rule of thumb when we think about how much hay should we be feeding our horses through the winter is just to think about a horse with a dry winter coat. So like a horse standing out in the pasture that's not wet, it's just standing there, he's totally dry, has a critical body temperature of 0 degrees Celsius or 32 degrees Fahrenheit. So that just means that a horse at that temperature is able to maintain their body weight and their body temperature basically flat. They can do that. That's an okay temperature for them. Once we start to climb below that, the horse's body needs more energy to keep their body warm, and that increases their caloric need. So as we think about going down, once we get to about negative 18 degrees Celsius or 0 degrees Fahrenheit, a horse would have about a 30% increase in the caloric need. So when we think back about that 1,000-pound horse, now that horse would require about 20 to 26 pounds of hay per day, or additional calories from some other way. So I know there's certain horses that, you know, you're going to max out the amount of hay that you're able to feed them, whether that's from a budget standpoint or whether that's from they just can't eat that much hay in the day. In which case we do have other options like grains. I will say if you're going to add in a grain, there are better options such as higher fiber type grains. We typically want to stay away from like the pelleted or the sweet feed type grains, because that's when we start moving more into those really high omega-6 kind of diets. And we want to kind of stay away from that and stay more into giving the horses fiber, allowing them to create energy in their hindgut, because that's a more natural way for them to create energy. So thinking about other things that maybe horses aren't getting from their hay. So we know that they can produce a lot of things in their hindgut, including energy, protein, they get protein from their hay, they get calcium, phosphorus, a lot of the big blocks. But we also know that there are certain things that horses don't get from hay. So when you think about forage or grass that's dried out to make hay, it's not just water that's being lost in that. A lot of critical nutrients that horses need are also being drained away from fresh green grass. One of those things is omega-3 fatty acids. So, we talk a lot about these fatty acids, the omega-3s and the omega-6s, and really the reason that they're so important is because every single cell wall in your horse's body, every single cell is surrounded by a phospholipid bilayer, which is made out of fat. So every single cell requires these fatty acids for them to function the way that they should. So they're extremely critical in your horse's body, and they're extremely abundant in fresh green grass. But the problem is when we think about drying out that grass and turning that into hay, we see that we quickly lose a lot of those omega-3 fatty acids. And you can see here, this is alfalfa hay. So it typically has quite a high level of omega-3 fatty acids. But just 10 weeks post-harvest, it's already lost 83% of the omega-3 fatty acid content. Another example would be vitamin E. So some of these kind of fresher nutrients that we see are very abundant in fresh green grass or fresh green forage, alfalfa in this case. But when we dry them out, we see that just 6 weeks post-harvest, it's already lost 86% of the vitamin E in the alfalfa. So just some things to kind of consider when we're thinking about it's not exactly the same feeding our horses even a good quality hay versus being out on fresh green grass or fresh green forage. Another thing to kind of consider is the amino acid profile in your forage. So these are the 10 essential amino acids. And again, essential just meaning that they need to get these amino acids from their diet. They're not able to make them in adequate amounts in their body, so they need to get them from an external source. And the tricky thing about amino acids is they're limiting. So they need certain amino acids to be able to produce or utilize the other amino acids. So it's kind of a funny Tetris puzzle to say, okay, which one of these are we going to run out of first, and making sure that we have a full amino acid profile that our horses are able to utilize. I think, when I think about amino acids, I always think, amino acids are the building blocks of protein. That's kind of drilled in my head from 8th grade biology. But it's interesting to see how much more amino acids contribute to a horse. I think a lot of people reach out and say, oh, I'd like for my horse to have better hoof quality. I want, more hoof. And so, the first thing you think of is maybe biotin or more of those minerals, things that horses need to put on good hoof, which is true, but hooves are made of amino acids. They're made of protein. And so making sure that you have a full amino acid profile and you have all of these building blocks that your horses need to produce those things is really key. So thinking about ways that we can see through the winter or anytime really, how is our horse doing from a nutritional standpoint? How are we tracking? Do we need to maybe add more of something, less of something? I think for me, the winter is especially tricky because, we get our big fluffy winter coats on and it's really hard to know. And it kind of comes into a spring surprise when they shed out in the spring and maybe they're a little underweight or they're a little overweight. It can be really hard to tell. So how many of you guys have learned about or talked about a body condition score before? Okay, I can't see you guys, so I'm just going to have to assume a lot of you have. So body condition score is basically just a way to tell how horses are doing as far as fat coverage on their body. So how are they doing? Are they skinny? Are they fat? Are they somewhere in between? And the way that the scale is designed is looking at these 6 different places on a horse's body where fat is typically stored. So some of those include the neck, the withers, over the ribs, the tail head. And the idea is to say how much fat is this horse storing right now. And we can kind of put them on a scale to say, again, are they too skinny? Do we need to put on some calories? How are we looking as far as calories and fat storage? That's really all that we're looking at. So this scale is from a 1 to a 9. And typically we say if you're under a 3, you're underweight. If you're over a 7, you're overweight. Above that, you kind of fall into the obese category. So in general, we want horses to fall somewhere between a 4 and a 6, depending on what you do with the horses. It can kind of change a little bit there. And if you are in the 4 to 6 kind of range, one way that you can kind of tell, even with a fluffy coat, is if you take your hand and you run your hand kind of along this big blue circle here in the middle, right over the ribs. You don't necessarily want to be able to see the ribs, but you should be able to feel the ribs under there somewhere not too deep in there. So I think it's a nice way to kind of check through the winter. How are we doing as far as calories go? Are we dropping weight? Do we need to maybe add in some more forage or add in another source of fat or calories for this horse to make sure that we're staying on top of our horse's overall body condition? The other thing that maybe is less talked about is top line evaluation, or looking at the muscle on our horses. So again, body condition score is really great for looking at the amount of fat that's stored and the amount of overall calories that our horse is storing in their body. The top line evaluation more looks at how is our horse holding up muscle throughout the winter. So I see this a lot. I have an older Belgian mare that if I don't watch her, she can kind of turn into just a lot of bones over the winter. And what ends up happening with her is she'll keep her belly, she'll keep fat over her, but she really loses a lot of her top line. And so making sure that I supply her with a good source of fat, but also a good source of amino acids throughout the winter helps her to maintain both. So we want her to have a good body condition score. We want to make sure she has enough calories, enough energy to keep her warm, keep her healthy throughout the winter, but also making sure that we don't fall behind on her muscle and make sure that they're able to maintain their top line and their muscle quality throughout the winter as well. Okay, so thinking about some solutions as far as, okay, how do we feed our horses? A good place to start is, like we talked about, maxing out our forage. So making sure that we're giving our horse enough forage that they need to ferment in their hindgut to turn into an energy source, to make sure that they have enough calories, enough energy, enough fat throughout the winter, and then adding back in the things that horses can typically be missing. So as we mentioned, some things that are typically missing from even a good hay source, a dried hay source, is omega-3 fatty acids. We also want to provide them a full amino acid profile, as well as vitamins, trace minerals, and then antioxidants to help with oxidative stress. So when Dr. Herthel was developing the product, really the idea was give the horses a good forage source, let their body work in the way that it's naturally supposed to, and then let's add back in what they need to equal kind of pasture in a bucket if horses could be out on fresh green grass all the time. So simplifying the diet, making sure that they're getting what they need from a forage source, and then bringing back in those things that are typically missing. Another great option, so speaking of my Belgian mare, this is a product that I use on her during the wintertime. So I don't know if you guys use oil much in your area, but it can be a really great option for giving your horse extra calories, which without giving them a huge amount of carbohydrates or a good amount of sugar. So a good fat source, allowing them to put on some extra calories, have a little bit of extra energy without spiking those omega-6s and also worrying about giving them too much carbs, too much starch, things like that. So our option here is it's called Healthy Weight. It's an omega-3 fatty acid oil. So again, giving them a high dose of omega-3 fatty acids as well as that vitamin E. So really looking at, if your horse needs additional calories, it's a way to add in those calories without having to add in larger amounts of grain, larger amounts of those omega-6 fatty acids. Okay, so kind of just putting this all together to say, some winter feeding tips in general. I guess my biggest takeaway would just be to start with a really good source of forage. So as we've talked about all through this presentation, horses are hindgut fermenters. They really need a good source, a large source of forage to be able to get the energy that they need. And from a physical standpoint, they have this huge hindgut that needs to have, basically constant amount of forage in there. So thinking of different tips of ways that we could give our horses larger amounts of forage. I know a lot of people like to use like a small whole bag, things like that, or hay feeder, to allow your horses to have kind of replicate that 16 hours a day that they would be getting if they were out naturally grazing. We also know that a lot of times we need to increase forage as temperature drops. We have a really great kind of a calculator on our website if you guys are interested in kind of more precise amounts of how much to be feeding your horses through the winter. It's just platinumperformance.ca is our website, and you can go on there. We have a great article about feeding through the wintertime, and it really talks about, if the temperature drops to this amount, what's kind of the increase of calories that my horse might need to maintain their body weight. So again, thinking about maintaining our horses through the winter, making sure that they have enough calories, enough energy, but also enough amino acids to maintain their body condition and also their top line as well. So a great article, like I said, it's at platinumperformance.ca. You can just search in the search bar winter and it'll come up winter feeding tips. And it has a nice calculator there to kind of help decide how much pound wise would you need to help maintain your horse's body condition in general. I think those are good guidelines, and it is helpful to have kind of, you know, tools like that at your side. But the better way to do that, or the easier way to do that, would just be to keep an eye on your horse. You know, run your hand along their ribs, make sure that they're not dropping weight. I will say it's better to stay on top of it than it is to get behind it. I think if any of you guys have tried to feed up an underweight horse, it always takes longer than we would want. So I always try to kind of get started early with getting our horses kind of maintained for winter. So my Belgian mare, I already have her on Platinum Performance and Healthy Weight, as well as upping her hay going into winter, so that I can kind of stay on top of that. And then just keeping an eye on them, thinking about that body condition scoring system and those places that horses typically hold fat on them, and just making sure that we can feel their ribs, but we can't see them, you know, we're not getting too bony, that kind of thing, and that our horses are staying in a good condition. Another really important thing is making sure that our horses are intaking an adequate amount of water and also salt. So I think, you know, one of the biggest contributors to colic during the winter is horses not drinking enough water. We know as the temperature drops, horses drink less water, which is very problematic. If you think about horses holding 90 to 135 liters of volume in their hindgut, if you don't have enough water to lubricate all of that going through there, it becomes very problematic. So encouraging horses to drink, some ways that you can do that include having heated water, which I know isn't always realistic, but if you can add a heated water to your setup, or if you can bring out your horse's hot water and add 2 every now and then, horses will drink warm water better than they'll drink cold water. Another way to increase water intake is to add salt to your horse's diet. So as any of you guys know who have eaten salty foods, the more salt intake you have, it drives thirst in horses as well. So, you know, you can say we can lead a horse to water, but we can't make him drink. But we kind of can if we make him thirsty enough. And so, you know, one option would be to leave out a salt block of some sort. Is always a good idea to have free access to salt. But also during the winter, considering adding in salt, like a tablespoon of salt into your horse's feed as well, to increase the amount of water intake that they're having. And then finally, just to think about adding back in nutrients that your horses might be missing from a dry forage-based diet. So thinking back to, you know, when we don't have our horses on fresh green grass, what are those fresh nutrients that they're missing, and what are ways that we can get those back in the horse? So again, some of those include omega-3 fatty acids, a full amino acid profile, and certain vitamins that are typically found in fresh forage only. Okay, so I think that's kind of what I have as far as feeding tips. Do you guys have any questions about more of a natural diet or tips for feeding horses throughout the wintertime?
Any questions for Madeline? Margie?
The product that she has, I think, is the bucket that's there. Would it work for, so one of the thoroughbreds that we have is in great shape, other than he has really poor feet.
Mm-hmm.
Is that something that would help?
Madeline, did you hear that at all?
I didn't. No, sorry.
No, the question was about the regular Platinum Performance, if that's good for foot hoof health.
Yes, yeah, it is. So I typically, when people ask for a hoof supplement, that's typically where I start, is with the Platinum Performance Equine. Like I said, I think it's really important to have a good foundation for what your horses are having before adding in kind of spot treatments. The great thing about the Platinum Performance Equine is omega-3 fatty acids are going to have a big impact on healthy skin and coat, but also on hoof health. It also has that full amino acid profile, so making sure that they have the building blocks to put on more hoof or grow more hoof. But then it also does have biotin and niacin and methionine, all of the ingredients that you would really want in a hoof support kind of product already in the foundation formula. So yes, I would always recommend starting there if you need a hoof support formula. We do have, you know, as you guys know, if you've looked through a Platinum catalog, we have a lot of different support formulas as well. So we do have a specific hoof support formula, which is more for, you know, if you have horses that have severe hoof problems or need more of those ingredients. But I would say starting with the Platinum Performance Equine, you're going to get those same ingredients plus the omega-3 fatty acids plus the full amino acid profile. So yes, it will be very beneficial for hoof health.
Great, thank you. Yes.
Yeah.
Say a 12-year-old horse, like, is that something that would be beneficial for the gelding?
Yes, so the question, Madeline, is for a 12-year-old horse, so a younger horse, is it still a beneficial, the regular
Yeah.
Platinum?
Exactly, yeah. So, you know, when Dr. Herthel made the product, it was really designed for every horse in the barn. So the idea is all of the horses should be eating like they were out on fresh green grass. And I do think that's kind of a tough thing, is to think about, you know, I think some people look at Platinum and they say, oh, well, it's a supplement. But really it lives kind of in the intermediate world, because it's not a feed, it's not a supplement. It is something that's supposed to be given to horses every day, and all types of horses. Yeah, it's really designed to give all horses a good foundation of nutrition when fed with a good forage source.
Great, thank you.
Yeah, thank you.
Next question. Yeah.
Yeah, I was wondering, the Platinum Performance has like a bone tendon supplement?
Yes, yes.
Yeah, is it okay to just feed it as a kind of preventative to a young horse, like a 2-year-old, 3-year-old?
Yeah, great, Madeline. The question was kind of the ortho product or the joint products, are they good to feed as a preventative to a young horse?
Yes, yeah, definitely. I think it depends on what's going on with the horse. You know, most young horses that don't have any issues yet, I think would be fine on the Platinum Performance Equine. Really what we're trying to do is limit the amount of inflammation. As we talked about arthritis, one of the components to arthritis is inflammation in the joints. Another one is wear and tear. And so, you know, when we think about our sport horses, yes, the Platinum Joint Care can be used as a preventative as well. Do all young horses need it? Maybe not. I think it depends on if the horse is, you know, in a very heavy amount of work, is seeing a lot of wear and tear on the joints, or if you know, if the horse has had an injury, something like that, then you can consider adding it in. It certainly won't hurt to give it to those horses. And I do think, you know, as far as a preventative standpoint, it has glucosamine, Cetol-M, MSM, it has hyaluronic acid in there, so it really does help to kind of, maintain joints as well. It just kind of depends on the level of work that your horse is in. It certainly wouldn't be a problem to feed it to a young horse. I just don't know that all young horses necessarily need it quite yet.
Great, thank you.
Yeah.
Any more questions? Way in the back. So the question is, a senior horse feeding through the winter, would you recommend the Platinum Performance or another product?
Yeah, I would do the Platinum Performance plus the Healthy Weight, especially if they have trouble keeping weight on during the winter. Obviously, with old horses or senior horses, you have some other considerations too. Like the biggest one I would say is making sure that they get a dental before going into winter, making sure that their teeth are good. When we think about processing forage, that does happen in the hindgut, but it starts in the mouth. It starts with chewing. It starts with acid. So, making sure that we have all of those pieces in place as well. So a good dental, making sure they have a good source of forage. If you're seeing a lot of kind of unprocessed hay coming out the other end, another option is to feed them something like a high fiber type feed, so like a senior type feed, something like that you could add in to give them extra calories without giving them a huge sugar spike. So I would say the Platinum Performance Equine and the Healthy Weight are a great place to start, as well with a good forage source and a dental, of course.
Great, thank you.
Yeah.
One more question, and then we're going to wrap it up. Anything else? Right there. Okay. So the question's the other way. Do you have something for the overweight horse?
So yes, we do. So I think there's this kind of a two-part answer to this. I'm just gonna say the Platinum Performance Equine is a great product. Have any of you guys I know you have, Dr. Berezowski, but if you've seen the product, it's a very small volume of product. So it's a high-fat supplement, but it's only 8 ounces per day, and it's very low in sugar and carbohydrates. So it's actually a great option for an overweight horse because you're not adding in a lot of calories, you're not adding in a lot of carbohydrates, but you're still making sure that that horse has the base nutrients that it needs as far as fats, amino acids, vitamins, and minerals. So will it necessarily help your horse lose weight? I don't know about that, but it will not add to the weight problem, and it will make sure that they're getting the nutrients that they need. As far as losing weight, I would say, you know, it's one of those things probably more on the forage side. So limiting the forage, again, I wouldn't go much below 1.5%, but you can get lower starch feed, really focusing more on the carbohydrate intake, the starch intake of those horses. But I do think Platinum Performance Equine is a great product to make sure they're getting their base nutrients without giving them all of the sugar and things that they really shouldn't be having.
Great. Well, thank you very much, Madeline.
Yeah. Okay, thank you guys for having me on. It's good to see you, or good to talk to you anyways. Let me know if I can help with anything.